have a louder clap for the Ozone family? Everybody, give it up for yourself. Alright people, are we excited for today? No, I cannot get the feedback here. Are you guys excited? Alright, so one more time, give it up for yourself, everyone. Clap for yourself loudly. Ozone Forum of India welcomes all delegates from medical fraternity and for empowering knowledge on ozone therapy as an integrated approach. This year's theme is Healing Festival, where we must celebrate our knowledge and wisdom for the betterment of society. So people, with an honor, I would like to call Dr. Millie up on the stage for giving you a warm welcome. Thank you so much, Millie ma'am.
So, it is my great pleasure to welcome you all for the 13th Annual International Ozone and Longevity Healing Festival. Why Healing Festival? Because I wish that we celebrate this moment and be on the journey of wellness besides illness. It is my absolute honor and privilege to welcome all of you on this great occasion where brilliant minds will exchange knowledge and we will explore cutting-edge advancement in ozone therapy, health optimization and longevity science. This year is no exception that we gather experts, practitioners, researchers, innovators from all around the world to exchange knowledge. We share groundbreaking research here, and this is our tradition that every time when we have a conference, we want to celebrate what we learn in our practice. Ozone therapy has made few remarkable advancements since last 2 years when we met last time, that was to 2023. We have worked on cellular regeneration, its impact on immunity, overall betterment, neurodegeneration, and many more conditions in last 2 years and have gathered knowledge on lot of autoimmune diseases. Yesterday in our pre-conference, we shared all the understanding on autoimmune conditions, ozone's protocol, clinical tips on ozone therapy, ozone and Ayurveda, and I thank all my pre-conference speakers to lend their full day to us without any fuss. We will be talking about all the aspects of ozone and longevity. We will explore new clinical applications as well. And Dr. Lamberto Ray this time is going to talk about the exact dosage and why should you adhere to those dosage that is important to us. I want to extend my deepest gratitude to all my speakers, sponsors, organizers, and especially all of you. I think we all should clap for us. Because you make our conference happier and you make our conference, that we can share and understand much more than what we decide to do. Thank you very much and enjoy the conference. Thank you, and this is the second floor. We are going to have all the lectures here. On the third floor we have exhibition and we have food arrangements. So this is a regal hall, third floor is a crystal hall, and all the lunches, tea breaks and exhibitors, if you wish to meet, you will have to move to third floor as and when required. So next we will start our scientific session with the first segment. Thank you very much.
Now I request Dr. Gautam Shah to present his topic, ozone and musculoskeletal pain. Dr. Gautam Shah has had 30 years of experience in trauma and polio corrective surgery, where he received an international award for performing the maximum polio deformity correction surgeries in the world. His other interest lies in saving the diabetic foot from amputations. Thus, his applications of hyperbaric oxygen therapy and ozone therapy helps to save limbs. His main focus of interest lies in knee preservations rather than knee replacement in osteoarthritis of the knee joint. Thank you, Dr. Gautam Shah, for your wonderful inputs on pain management. Please grab the stage.
Thank you so much. Good morning, everyone. being the opening batsman, I'll try and make the talk as simple as possible. The issues here in the musculoskeletal problems in orthopedics is looking for a simple solution for a complex problem. So let's see, I'll try and make this topic as simple as possible so that it's easy for everyone to understand. And here I will be showing you more of the clinical pictures and photographs, and also some video testimonials of my patients whom I have treated with the help of ozone therapy. Using ozone therapy as a combination therapy, or using it as one of the modalities of treatment. Here you see the ancient Hebrew meaning of ozone is the breath of God, and reaching results in human health care has become a reality and is being practiced widely today. Ozone therapy also complements standard treatment, reducing the duration and side effects of other therapies. This is an important slide, and we all believe in this. At certain times we use ozone therapy as a monotherapy, but many a times we use it in our practice, and whatever pathis you are practicing, either allopathy, homeopathy, Ayurveda, etc., anything you are practicing, if you are incorporate ozone therapy as one of the modalities of treatment, combining it as a multimodal treatment, I'm sure you will definitely get good results. So what are the conditions, and why do we treat, and why is ozone becoming so popular with musculoskeletal problems? So mainly it has a very strong anti-inflammatory effect, it has antioxidant effects, it's improved oxygenation and modulation of pain pathway. That's the most important one. It modulates the pain pathway. And in orthopedics, when you're treating the musculoskeletal problems, what are the methods of administration of ozone? One is we give intra-articular, peri-articular injections. All of you have been trained for this or have seen the demonstrations being happening in the basic course as well as the advanced course. And the other important is the intradiscal injections, where we have slip disc or sciatica pain, and these patients are treated with the help of ozone. So another route by which we can give ozone is intradiscal. Of course, the soft tissue injections to take care of the trigger points, and topical applications and per rectal. So these are different methods by which we can use, administration methods by which we can use to treat the musculoskeletal problems. So what are the conditions treated with ozone therapy? See, in my clinical practice, what I have found out, these are some of the common conditions which we come across in the OPD. So patients usually come with either a low back pain or having osteoarthritis, knee pain, osteoarthritis of the knee. Avascular necrosis of the femoral head has become very common post-COVID. We get to see a lot of patients with AVN. And of course, the treatments of AVN differs from stage to stage 1, 2, 3, 4. It all varies on what stage the patient comes in. But adding a major autohemotherapy, and I'm doing something what is called as the ozone diastasis, or it's called as the basically diastasis of the joint means joint distraction. When you distract the joint with ozone, I will show you the results, and I will show you some of the patients where we are doing intra-articular ozone orthodiastasis. That's what it's called. It's called intra-articular ozone arthrodiastasis. That's something new which I am doing nowadays. So I'll be talking on that. I'll be showing you a few slides on it. Then of course we have tendinitis, ligament sprains, fibromyalgia, sciatica, slip disc, tennis elbow, bicipital tendinitis, plantar fasciitis. These are all common conditions what we come across in our OPD and day-to-day practice. So what are the benefits and advantages of ozone? It is first minimally invasive, low risk with minimal side effects or no side effects. It has a quick recovery time. Most of the procedures are OPD based, and it is a daycare procedure. Of course, it is cost effective. So these are some of the many advantages of ozone. and you can do it in your daily practice. We all have been doing it regularly, and most of the patients are dealt in the OPD. Few require admissions and few require surgical operation theatre procedures. I will be talking of them also. So starting with the clinical cases, I'd like to speak first on the low back pain or the slip disc, commonly also called as the sciatica. And here you can see that patients, they complain of pain. Nowadays we get to see a lot of slip disc cases, especially people working in the technology field and where they have to sit and for a longer duration of time. Also, patients are doing heavy weight lifting and all. So here you have patients complaining of low back pain. So these are some of the causes and reasons where we see patients having low back pain and are being treated. So there are various treatment modalities available for low back pain or slip disc. Right from conservative management to physiotherapy to minimally invasive procedures like the ozone therapy, and of course we have the surgical procedures like microlumbar discectomies and various other surgical procedures to treat the slip disc. All are good, but as I said, I'm here to discuss about solving complex problems with simple solutions. So this is what I feel, and this is what happens in a slip disc. The pathology is the nucleus pulposus is slipped off and it goes and compresses on the nerve root, and we have the diagrammatic presentation where it shows the nerve root being compressed like L3, L4, and that's the distribution. So once you do an MRI and check whether the disc is compressing the nerve root accordingly, then you select the patients and then take them in for something what is called as the ozone nucleolysis, or is called the ozone discolysis. Under local anesthesia, with this procedure I've always done in the OT under a CIAM guidance. It is a local procedure. The patient is in prone position. With the CIAM image, we exactly locate the disc space, and under local anesthesia, the patient in the prone position, we inject the needle into the disc space after knowing the space properly, and we inject the ozone gas. The concentration what I used to inject into the disc space is about 60 micrograms. About 4 to 5 ml of ozone can be injected inside the disc space. Once you enter into the disc space, this is the CIAM images which shows that whether you are exactly into the disc space or not. Once you are into the disc space, this is the patient before. You can see the MRI where the nerve root is being compressed. That's the slip disc. And that's the patient after the ozone discolysis, where you can see very clearly that the nucleus pulposus, where you inject the ozone into the nucleus pulposus dissolves and the nerve root pressure goes off. So you're giving results as good as a surgical discectomy with minimally invasive procedures. So some of the patients whom I have treated with low back pain are giving their testimonials. This is my patient from Himachal Pradesh. I will visit.
मैं हिमाचल प्रदेश के सिसु से बिलोंग करती हूँ। मेरा नाम छेरिंग है। मेरे कमर में बहुत ज़्यादा दर्द थी, तो मैंने मुंबई के डॉक्टर गौतम शाह वो मिशन हॉस्पिटल में आए थे, तो उन्होंने मेरा इलाज किया, तो मैं बिल्कुल ठीक हो गई हूँ। इसलिए आपको भी यदि दर्द हो तो आप मुंबई के डॉक्टर गौतम शाह से ज़रूर इलाज कराएं। मुझे देखो, मैं बिल्कुल ठीक हो गई हूँ।
So there are patients who are they have to do hard work and to ensure that their daily activities are going on, and they need to get back to their work. So it's important that these patients are fine and we do them without surgery.
क्या तकलीफ होती है? दर्द ये कमर पास से पैर में नासिक एक कोपरे से लेकर तकलीफ इतनी होती है कि मैं 5-10 मिनट के अंदर मेरा पैर है या नहीं मालूम नहीं पड़ता, पंजे तक पूरा दर्द हो जाता है।
कितने दिनों से दर्द होता है?
ये 1.5 महीने से तकलीफ थी, बाकी अभी 4-5 रोज से बिल्कुल पैर ही नहीं लिया जा रहा है। 5 मिनट खड़े रहने के बाद तो मालूम पड़ता है कि पैर ही नहीं है मेरे पैर।
क्या काम करते हो?
मैं ड्राइविंग करता हूँ, गाड़ी चलाता हूँ।
So he's a driver by profession, needs to get back to driving, cannot afford a surgery, and this is where he came to the OPD.
Right side का?
He has a positive SLR on the left side.
Left वालों का?
You can see him, he's in severe pain, unable to get up. It's a fresh case of slip disc in the L4-5 region. He was diagnosed with the L4. We've done the MRI and we saw that there was an L4-5 disc. You can see him is absolutely in pain, unable to walk. In the next case, you can see the way he is walking. The same patient was taken in the OT, and I did perform an ozone discolysis, and of course, to my surprise, he did so well that once he came out of the theatre, so along with the ozone discolysis, we also do a nerve block. So I have a longest follow-up of this patient of 18 years. He came to me 18 years back, and the last week before I was presenting, making this presentation, he came for a follow-up, and it was 18 years ago.
इंजेक्शन से पहले और इंजेक्शन में बात कितना फर्क है? पूरा फर्क पड़ गया। मैं 100% अभी है ही नहीं मेरे शरीर में, अभी दर्द ही नहीं रहा है। तो मैं से पहले पैर लेके नहीं चले जाता।
So this was the case. Here you can see he came to me 2 months. This I'm talking 18 years back. When he came to me after 2 months, he was fine. He got back to his driving.
कमर में ये 2 महीना हो गया, 2 महीना हो गया। अभी कोई प्रॉब्लम, अभी कोई तकलीफ नहीं है। जैसा पहले ड्राइव करता था, ड्राइवर उम्र का पूरा तरह से गाड़ी भी चला रहा हूँ, नाइट पे गाड़ी चला रहा हूँ, कोई तकलीफ नहीं है। चल कर दिखाओ।
So you saw him before the procedure, how he was walking, and 2 months later, he's absolutely fine and pain-free. And then when he came back to me, this is after 18 years, he's still pain-free.
सब डॉक्टर ने 2-3 डॉक्टरों के बाद ट्रीटमेंट के लिए गया, उन्होंने ऑपरेशन कराया कि मुझे। फिर मैं अपने सर गौतम सर के पास में आया, तो उन्होंने मेरे को चेक किया और वो से इंजेक्शन लगा कि मेरे को आज 18 साल से कोई नया बच्चे का तकलीफ नहीं हो रही है। अभी निकल चलाता हूँ, उठने बैठने घूमने चलने करने में मेरे को कोई दिक्कत नहीं है। पूरी जब से मैंने 1 रुपये की खबर दर्द की।
और यूनुस भाई ठीक है ना अभी?
एकदम बढ़िया है, एकदम कोई तकलीफ नहीं है।
So when we have these kind of modalities of treatment, then why do we need to go in for surgical techniques? Of course, we do have specific indications for surgery, as if you have a red flag, like if you have a neurodeficit, EHL is weak, and there is a bowel bladder involvement, then definitely surgery is the first choice. This is another case of low back pain where you see him walking. He has a slip disc at L4-5 level, extremely painful, unable to walk. The same patient, you can see after ozone discolysis, his SLR is free, and now he is able to walk pain-free. So these are simpler solutions which we can avail, which patients can afford it. And here you can see the patients immediately post lumbar discolysis. He is doing very well. He's pain-free and he's walking and he's happy. So this was what happens is it has got minimal side effects, minimally invasive. It's compliant with the patients, shorter than a daycare procedure, quick recovery and no discomfort, and short absenteeism from work. Another common complaint is the osteoarthritis of the knee, where we have been treating a lot of osteoarthritic patients with the help of intra-articular as well as peri-articular ozone and prolozone therapy. This is my patient from Manali, and I've been visiting Manali very often, and I conduct these pain management camps over there. This is a patient who has got severe pain in the knee, was unable to walk. किधर दर्द होता था? किधर दुखता था? अभी ठीक है? हाँ। अभी आराम पड़ गया। These are the patients who are advised for a knee replacement surgery. Obviously, the cost of knee replacement surgery is escalating day by day, and our patients cannot afford a knee replacement surgery. So these are simpler solutions which we can give to our patients, and they are happy with this.
बोलो कैसा लग रहा है?
ऐसे बहुत अच्छा लगा, दर्द भी कम हो गया, बहुत काम किया, बड़ा भारी दिल में शांति हो गया, इधर उधर भी चल सकते हैं, कहीं दूर भी गए, मैं भी गए, बहुत काम भी किया, गाय का इंतजाम भी किया, खाना बनाया, घास ले आया, सब कुछ किया, अच्छा लगा।
So I feel for the rural population, this is a better option, what we can afford. This is another lady, she's obese, unable to walk, stage 3 osteoarthritis.
This patient is having bilateral osteoarthritis of the knee joint.
Advised for a knee replacement surgery. She works in somebody's house as a maid and cannot afford a knee replacement surgery. You see, she is absolutely in pain, unable to walk, walks with support, unable to get up, unable to squat, unable to sit cross-legged, and all her day-to-day activities are hampered. So this was the patient before the treatment, and you can see the same patient after the treatment. She's come back to me again after 2 months. Here, she's perfectly fine, able to sit, able to walk.
What about the now?
And the same patient came back to me after 6 months. Then you can see the change in the difference in the gait. She appears to be happy and perfectly fine.
ऐसा है?
ठीक है जी, अभी तो बहुत अच्छा हो गया।
क्या तकलीफ थी?
गोडे में दर्द था, हाथ में दर्द था, अंगुली ऐसा हो के सीधा नहीं होता, अभी तो सीधा सीधा हो गया।
घुटनों में कैसा है?
घुटनों में बहुत अच्छा, बहुत बढ़िया हो गया।
शुक्र।
हाँ,
Another lady who was in the wheelchair.
पाटा लगा, उसके बाद से वो चलते ही नहीं आ रहा, वो व्हील चेयर पे चलने लगे। तो पैर में दर्द इतना रहता है,
किधर?
घुटने में खड़े नहीं होते बनता, चले नहीं जा रहा मेरे से, इतनी तकलीफ है मेरे को, व्हील चेयर पे चलना पड़ रहा मुझे।
So she's on the wheelchair, not been walking. She has been walking with support. There you can see post procedure. She's absolutely fine and pain free.
और कैसा लग रहा है अभी? खड़े रहो।
There she's pain free and able to walk. Again she came back to me after about a year or so.
दर्द हो गया कहाँ है?
And here she is pain free. So these are some of the common problems we come across, especially practicing in the rural area. It becomes extremely difficult to offer them any surgical options. So the options of doing prolozone intra-articular, peri-articular is good. You can repeat it after 6 months or so. There is no fixed protocol for any osteoarthritic knee patient that you have to inject after 15 days or 1 month. Depends on the stage of the arthritis and how obese the patient is. Another common condition seen is the frozen shoulder. You can see before and after. Here the patient has been treated with the help of ozone, peri-articular and intra-articular. Here you can see the left shoulder is extremely painful. You can even see it on a face. Here the right shoulder goes up well, the left one is extremely painful.
कैसा लग रहा है?
Here you can see the same patient immediately after the prolozone injection. Here the shoulder is pain free and mobile.
ठीक लग रहा है।
So the same patient, these are, as I said, these are all OPD based procedures which can give you quick and good results. So another important topic is ozone arthrodiastasis. Here you can see arthrodiastasis means distraction of the joint. Here you can see the needle is being placed into the hip joint, the dye is injected ensuring that the needle is inside the hip joint, and here you can see the case of bilateral AVN, the ozone gas is injected into the hip and you can see the hip is getting distracted. You can see it on the left side as well as on the right hip. So I'm doing this for a lot of avascular necrosis patients. This helps to increase the blood flow, it also helps to decrease the intra-articular adhesions. You can see the gap has been increased from the normal hip, and this is what has helped us. So the mechanism actually reduces the tension on the nociceptors, increases the joint space, improves joint lubrication, reduces inflammation and stimulation of mechanoceptors. All these things help to reduce the pain and improve the function. Another case of chronic osteomyelitis treated with the help of ozone, and here you can see the osteomyelitis patches have healed. Osteomyelitis of the femur, here you can see a sinus, draining sinus. The ozone therapy was done, injections of ozone, oil injections, major autoimmunotherapy. Here you see the healing of the ozone, the ulcer has healed, the chronic osteomyelitis has healed. Non-healing ulcers before and after. Here you can see the ulcer has healed well. This was a case of psoriatic arthritis. He came to me with knee pain, but he also had a lot of patches of psoriasis all over. This was during the time of the treatment, and this was after the ozone therapy treatment was done. He was pain-free. These are the several modalities of treatment used, and here you can see the patient before and after. All his psoriatic patches have gone off. Here another case of bicipital tendinitis and another case of lateral epicondylitis. Treated with the help of ozone. We give ozone in and around the epicondylitis, and the patients are pain-free. Common conditions like tennis elbow, golf horse elbow, all these conditions can be treated very well with the help of ozone therapy. The last is the plantar fasciitis, which is again very commonly seen. You can inject the ozone at the site of the plantar fascia insertion at the calcaneal spur, and the patients become pain-free. Another important, since this topic is so huge, another important is the diabetic foot ulcers. Here you can see before and after, some of the pictures before and after, and the ulcers have healed completely. So this is a patient again who came to me with the diabetic foot ulcers during the treatment and after the treatment, and the ulcer has healed. The aim is to prevent amputation, and this is what I have achieved. So ozone has gained popularity in various medical fields, especially in pain management. Newer modifications in the techniques and administration of ozone, more publications in the medical journals and animal studies have made it more acceptable to the medical community. Ozone is the ideal therapy because it complies with the father of modern day medicine. Hippocrates' first law of medicine is do the patient no harm, while offering a safe, simple, inexpensive and effective treatment that can add quality, quantity, health and vitality to every human life. Thank you very much for your patience.
The word is so true that his main focus of interest lies in knee preservation rather than knee replacement in osteoarthritis of the knee joint. I'm so much impressed by the success of recovery of many patients. Even I have a sciatica issue, so Dr. Gautam, surely I'll bring him to you to get a cure. Alright, thank you so much. Dr. Gautam, what a unique surname, is on ozone oil product and its benefit by Dr. Jignasha Captain. Dr. Jignasha is being Director Development in Ozone Forum of India as an instrumental in devising Indianized technique of vacuum MHT. Dr. Jignasha also facilitates ozone training and run ozone clinic for Ozone Forum of India. Her special interest in ozone oil has made different oil products and accessories of ozone therapy available for our doctors. She will be talking on ozone oil product and its benefit. Dr. Jignasha, over to you.
13th Annual Ozone Longevity Conference. Today's my topic is on ozonated oil and its products. Friends, as we know, ozone oil is very good for any kind of immunomodulatory, any kind of germicidal disease, any kind of oxidative stress disorder. But to take the benefit of ozone, you need to go to therapist. Sometimes disease like non-healing ulcer, 20 minutes treatment is not enough. You require longer exposure of ozone. Sometimes for some complaint, you cannot go every time to ozone therapist. So that time we can take help of ozonated oil and we can take a benefit, full benefit of ozone therapy. First, we will see what is ozonated oil. Ozonated oil has a highest antimicrobial activity because of its active ingredient ozonide and peroxide. When it exposed to skin, it goes inside your body and it releases ROS and lipid oxidation products, which helps in prolonged disinfection and stimulatory activity. Now, ozonated oil is made up of pure vegetable oil in India, we use sesame oil and olive oil. We bubble this oil for continuously for 100 to 200 hours, and end result is ozonated oil with distinctive odor. After ozonization, viscosity is also increased. Around 1 gram of oil can bind around 160 milligram of ozone. After ozonization, its characteristic modification we check by checking peroxide value. We keep 500 to 2000. While storing, no spectral changes, so half-life cycle of ozonated oil at room temperature is 1 year, and in refrigerator it can remain for 2 years. So what are the benefits of ozonated oil? Ozonated oil work as a detoxification. It's extremely effective in eliminating toxins from your body. It has an antimicrobial activity. Any kind of infection you can use ozonated oil. It increases oxygen supply to tissue. It helps as an anti-inflammatory. It reduces pain, swelling, redness. It has a stimulatory cell metabolism. It activates enzymatic antioxidant. It has a thrombolytic activity. It reduces the viscosity of blood clotting and accelerates the absorption of blood clot. So when we have started in 2002, we have started with this small oil bottle. But friends, this small bottle, it creates a big dhamaka, and slowly doctors are demanding more and more, and now today in 2025 we have this beautiful end product of ozonated oil. First product is ozonated rapetil oil. Ozonated rapetil oil is extremely effective in any kind of cut, burn, infection. You can use this oil. You can use it all over your body, except away from the eyes. You can even use for mouth ulcer, you can use for vaginitis, you can use for piles. Even for small cut to big ulcer, we use ozonated oil. So how it works? It controls bleeding. It helps in disinfecting the lesion. It inhibits the proliferation of potentially infective organisms. It improving metabolism. It stimulates tissue regeneration, and thus it helps in fast healing. In our clinic, even a big gathering after ozone therapy, we do dressing with ozonated oil. So these are some of my patients. Pseudomonas infection, diabetic foot, varicose ulcer. After ozone therapy, bagging, we do dressing with ozonated oil. And there are some reports. So in India, whoever wants to do research on ozonated oil, we provide ozone oil to them. And this one research paper, potentially ozonated sesame oil to augment wound healing in rats. So we have Ozone Forum of India has provided ozone oil to them, and then there are a number of research papers on Google. Second product is ozonated hair revive. It helps in dandruff, hair fall, thinning of hair, alopecia areata, headache, overtiring, and stress, and good sound sleep is bonus. How it helps? It moisturizes hair roots, coating of cell membrane, naturally nourished and conditioner to hair, rejuvenate dry and damaged scalp, improve blood circulation, thus it gives healthy, shiny and long hair. Nowadays, overuse of chemical is very common problem and people are getting hair fall. Hair oil is extremely effective in hair fall. This is a case of alopecia totalis before and after. Yeah, no, we have given ozone therapy also. So, ozone oil we give at home. Thank you. Pain relief. It is extremely effective in any kind of musculoskeletal pain. You can use for joint pain, body pain, inflamed tendon, backache, overtiring and stressed muscle. Second product is balm. So balm is also equally effective, but while traveling also you can use, and it is easy to use. It can use for migraine, headache, cold related headache, joint pain, injury pain. How it works? It helps oxidize lactic acid and other toxins. It helps in cell proliferation and synthesis of cytokines. It promotes synthesis of intracellular matrix and healing process. Thus, it increases blood circulation and it helps in pain. So we have done small study. We have given ozonated pain relief to number of people. 70% got 30 to 40% relief in pain for 4 to 5 hours and battle joint movement. 12% got 70 to 80% relief in pain and complete restoration of joint movement, and there is no change in 12%. So what are the conclusion? First stage of osteoarthritis will get 70 to 80% relief in pain and will get complete restoration of joint movement. Second stage of osteoarthritis will get 30 to 40 pain relief and some changes in joint movement. Third stage and fourth stage of osteoarthritis will get no relief in pain as well as no change in movement. So in first stage and second stage of osteoarthritis, ozonated pain relief is working extremely effective. Next product is ozonated skin blossom. It works on acne, black pigmentation, sunspot, dark circle, dullness, even sometimes like eczema and psoriasis. You cannot use rapidil oil because rapidil oil has some dry nature. That time you can use skin blossom and you can get a effect of ozone oil. It cleans, enrich, moisturize skin by make more elastic. It produces powerful germicidal effect. It bleaches senile spot and sunspot. When properly and responsibly used, will return your skin freshness, beauty and youth. So, a case like one where you can use cane blossom, and in this patient we got result in 15 days. Ozone miracle cream. No mark. Yes, yes. We have done only skin blossom cream. Ozonated miracle, you can use for anti-aging. You can use for wrinkle, you can use for aging spot. It iron out fine wrinkle, it return in elasticity, it normalize tissue metabolism, it intensify all trophic process in skin. It stimulates blood circulation, thus it has a natural skin repair cream. So this anti-aging cream, it is very effective for wrinkle, tightening of the skin, moisturizing of the skin, and it rejuvenates your skin. Next product is ozonated anti-acidity oil. You can use for gastritis, acidity, peptic ulcer. So acidity oil you have to drink 3 to 4 drops on empty stomach. Ability to cover the digestive tract, natural antiseptic, neutralize acid and helps in reducing inflammation. It repairs tissue damage caused by heartburn. Thus helps in maintaining aerobic intestinal environment. Last product is ozonated happy teeth. You can use for tooth decay, tooth pain and dental infection. For dentistry, we use happy teeth for toothache, tooth caries, dental infection and primary pins and fissures. For gingivitis, stomatitis, ulcer, we use rapidil oil. So rapidil oil you can use for gum, and for teeth you can use happy teeth. In happy teeth we have a oil, eucalyptus oil, so clove oil. Okay. So and rapidil is pure till oil. But you cannot use on gum, na? It will give you a burning pain. That's why only for teeth you can use happy teeth. Ozone. Yes, clove oil. This is my cancer patient. Here we have given ozonated oil application and we got result in 15 days. Here we got result in 1 week. So not only for topical, even for efficacy of high ozonide oil in prevention of cancer relapse. So you give treatment to your cancer patient, and for prevention, to prevent further relapse, you can give anti-acidity oil. So ozonated products are safe, healthy, natural, without any harsh chemical, as an alternative to topical antibiotics. You can use for longer period. The advantage of this method is simplicity. It is very simple. Under physician guidance, you can use at home. Physician can start good practice of ozone without waiting for ozone generator with the help of our wonderful ozonated products. And we create healthier and happier society. We help in creating happier and healthier society with the help of ozonated oil. Thank you.
Master Captain, with a big salute. Thank you for your input. Next lecture is on ozone integrated medicines in circulatory disorder by Dr. S.S. Sevia. Dr. Sevia is a pioneer in alternative treatments in cardiac care, president of the International ECBA Associations, referred to as the father of chelation therapy and non-invasive heart treatments. For nearly 30 years, Dr. Sevia has been at the forefront of non-surgical cardiology dedicated to helping patients avoid invasive surgeries through the use of advanced non-invasive heart care techniques like artery chelation therapy (ACT), enhanced external counterpulsation (EECP), and extracorporeal shockwave myocardial revascularization (ESMR. Let's hear from him about the use of ozone and other therapies in circulatory disorder. Dr. Sevia.
Ozone is oxygen, oxygen is energy. Good morning. First of all, my talk, I'll try to cut short, seeing the amount of time I've been given. So a lot of things in the slide I won't be able to explain, but you can all ask for my presentation, I'll send it. So welcome to everyone. Welcome to the delegates, welcome to the speakers, and thanks to the organization. Thanks to Dr. Mili. Every day we have news stories. And one of them we are hearing repeatedly is 25% of the total deaths in India are taking place due to heart disease. And other common thing is, patient has heart problem, he goes to the hospital and he is told, sorry, you are not even fit for angiography. Then we have another story. Patient goes to the hospital, his angiography is done. He requires stent or bypass as he is told. And again he is told, sorry, you are not fit for stent or bypass for any reason, maybe kidney problem, asthma, any reason. Then there are patients who have a heart problem. They have had stent, bypass repeatedly. I've had a patient who had more procedures than the fingers I have. Again, he is told, sorry, nothing further can be done. Then there are patients who are told that you require stent or bypass, and they say, sorry doctor, I cannot afford it. Or for cultural reasons, they don't want to go ahead with any of these invasive procedures. Then we have some dilemmas. Patients, we are saying repeatedly, they are having 99, 100% blockages on angiography, and they say, doctor, but I have not felt any problem at all. And there are patients who say, we are having chest pain, we are having angina, we are having breathlessness, but their angiography is normal. So you have both extremes, normal coronaries and angina, and blockages without any symptoms. Now, what is this happening? This is what the patient is always confused about. There's something which is known but not adequate awareness in the public is over there, that When you have blocked blood vessels but no angina, it means that your collaterals are very good. Your circulation is good, although there is blockages in the major blood vessels. As we grow up, our blockages start, I say, from the day you are born. A child born in Delhi, the day he is born, the atmosphere is polluted enough that it is equal to smoking 20 cigarettes a day. And so the day we are born, this process starts. And a balance is maintained between the blockages developing and the collaterals opening. And this balance is maintained. As long as it is maintained, there is no problem. Once balance is not there, then is what the angina starts. And then you have blockages. Then you have no blockages and angina. Because the major arteries are clear, but the microcirculation is not there. It is like the electricity coming all the way to your house, but from the pole to your house, the wire is broken. So it is the major blood vessels which are bringing blood right to the heart, right near the myocardium. But the ultimate link between the capillaries and the muscle, that is where the thing has broken down. So these are the patients who have no blockages, but they have angina. Now where is the missing link? The missing link is the angiography, the gold standard, so-called. It is no doubt the best test for studying blockages, but it cannot visualize smaller collaterals, the smaller blood vessels. If I put it more simply, when you are coming to Bombay, when the aeroplane is landing, you can, when you are higher, you only see the big roads. You are not able to see the small streets. As you come lower, you are able to see the small streets. So angiography is able to see the big roads, is not able to see the small streets. And that is where the whole crux lies. That if we start studying the blood flow along with the blockages, we will be able to get a clearer picture whether we are dealing with big blood vessel disease or with microcirculation. What we see is what we treat. And what blinds us is our ignorance. So we should measure blood flow. And for blood flow, we have got 3 very easy techniques. One is cardiovascular cartography, which I am using in every patient of mine. It is non-invasive. 256 heartbeats are studied, and less than 15 minutes, we have the report ready. Then we have stress helium, which is a nuclear study, and we have nail fold capillary. In that microscope, you put your finger nail under the microscope, and you can see the capillaries as you are seeing there. So this indirectly tells us what's the condition of the rest of your body's capillaries. So when we see blockages, we want to remove blockages. And to remove blockages, it is stent or bypass surgery. And when we think of flow, then a lot of other options are there. The lifestyle is there, ozone is there, ECP is there, ESMR is there, chelation is there, stem cells are there, and a lot of other methods. So it is all what you are saying. जो दिखता है वो बिकता है. अगर ब्लॉकेज देखोगे तो स्टेंट और बाईपास बिकेगा. अगर फ्लो देखोगे तो ओजोन बिकेगा, ECP बिकेगा, ESMR बिकेगा, stem cell बिकेगा. So it is what we see is important, and so we must try and see the blockages, but more important, the flow. Where ultimately the small blood vessels, they have a networking. Like every city must be Bombay also. You have a number of places from where you are getting the water, maybe from the underground water, and they are supplying different areas. At some place, they are all interconnected. So if one tube well is not functioning, you get the water supply from the nearby ones. Same in the heart. If one major artery is blocked, the network is getting the blood from the others. So that is the importance. I feel that the microcirculation is much more important than the macrocirculation. And this is the statistics. There are three types of coronary artery disease: purely macro, purely micro, and the mixed. Purely macro is only 5 to 10%, and mixed is 30 to 50%. And this is underdiagnosed because we are not tuned to think in that way. And 15 to 25% is a mixed. You have put it simply. The macro will be benefited by stent and bypass, and also by the other treatments. The micro will not benefit much with stent or bypass. Ozone, ECP, ESM are only more effective. And the last one, they should have both. So it is only 5 to 10% which will only benefit with the angioplasty and bypass. The solution is ozone, chelation, ECP, ESMR, ACT, etc. The heart disease, now we come to this. I'm just trying to make a base where the role of ozone comes in. But without that, you won't be able to understand that. So traditional treatments are chemical and mechanical revascularization, and they all have their own limitations. So we have to think of other treatments, we have to think out of the box, and that is all these treatments. The other studies which are showing that how ozone is beneficial in cardiovascular disease. You can have any of these modes of giving the ozone. History of ozone in the World War, when ozone was used for treating injuries and infections, they found that the inflammation and the blood flow also improved. And we are trying to apply the same in the rest of the body, in my practice, in the heart disease. If you talk about the prevention, inflammation and free radicals are responsible for the heart disease and many other problems. And ozone is taking care of that. Ozone removes the clumping of the RBCs. Clumping is that you can say RBCs piled upon each other. When they're piled upon each other, they are difficult for them to flow through the narrow capillaries. So if the Rolex formation, the piling is taken care of, the flow will be much better. Similarly, the more flexible the arteries, the RBC, the better will be the flow. And ozone is creating more flexibility in the RBCs. The ozone is producing certain chemicals, prostacyclin and nitric oxide, which causes dilatation of the blood vessels. And that again improves the circulation and also inhibits the platelet aggregation. And it also helps in more release of the oxygen. In congestive cardiac failure also, all these things are playing a role. So I'll put it that if we have a system, and that system is ozone, if with that we are able to decrease the Rolex formation, we are able to increase the flexibility, we are able to increase the diameter of the blood vessels, and we are able to release more oxygen. I'll say not only release more oxygen, when the blood is flowing, the hemoglobin releases oxygen and it also takes back that oxygen. If that taking back is stopped, the tissues will get more oxygen. That is how oxygen releases matters in ozone. This is again something very interesting. How much time I have got? We are seeing a lot of patients now who are having sudden cardiac death. They go to sleep at night. And they don't wake up in the morning. They go to the doctor, every test is normal. Because nowadays so many packages are there as preventive health. All the tests are normal, but one fine morning they don't wake up. And this sudden death is not due to blood flow decrease, it is due to the arrhythmias which are taking place. And this is again where the arrhythmias are inhibited or decreased with ozone. Next slide. To chelation therapy, I have added to ECP, I have added to ESMR, and to some extent, I have added it to the stem cell specific for the heart. So we can add to all of them, and they are complementary to all others. In chelation therapy, chelation will detoxify. It will decrease the stiffness of the arteries. It will decrease the stiffness of the arteries, and ozone will work better. In ECP, the blood vessels are dilated, dormant blood vessels open up, and there is more angiogenesis. Again, ozone is complementary to that. In ESMR, there is vascularization, neovascularization. Ozone again helps in that. So in all of them, ozone can be added to get better benefit. And I'm doing that since, I don't know when. I took training in 1998, but I really started practicing after I met Dr. Mili. So I've seen excellent results. It is very good before stent or after stent. Before bypass and after bypass. This can be a very good treatment. Next. The closing thoughts is the next gen wellness. Is a superhero, versatile, powerful, and always there to help, always there to save the day. Is a game changer, ready to shake hand with all other treatments. We can very well integrate it into any other treatment. I'll say, put it the other way around also. Ozone can be integrated with all other treatments, and all other treatments can be integrated into ozone. So let's join this revolution, take it ahead jointly. And I have a dream that with this we should be able to help thousands and lakhs of Indians. Because India, the biggest disease is poverty, it is not disease. And ozone is one place where we can really take, it can be a game changer. I have taken part in a panel discussion in the Parliament in UK, and the title was Ethical Sustainable Healthcare. So ethical sustainable healthcare is what we require, and ozone along with ECP, ESMR, chelation and all will have a very, very big role in that. And we are not only unblocking arteries, we are unblocking possibilities with ozone. Thank you very much.
Moving on to our next lecture, but before that I came to know that people are getting a little low. So let's maintain the energy so that you will be more active for the upcoming lectures. I need everybody till the end. Raise your right hand up in the air. Everyone, right hand up in the air. Point the finger towards me. One finger towards me. Perfect, perfect. Everybody, till the end. Make a triangle in the air. Triangle. Yes, very good. Triangle, perfect triangle. Okay, now write it down. Left hand up in the air. Point a finger towards me. Why are you making triangle? Who said that? Make a square. Make a square from your left hand. Alright, perfect. Now using both the hand, you have to make a triangle from right hand, a square from left hand, and I'm having a big bada prize for this one. Yes. Right hand, triangle from the right hand, left hand square, both at the same time. At the same time. Can I have the Galaxy Entertainment Management? Can I have the gift? Yeah. It's a humble request to the coordinator. Come on. Triangle from the right hand, square from the left hand. I'm having an eye on everyone. Okay. I guess you guys are walking in a band, huh? Come on, come on, come on, come on. Let me see, let me see, let me see. 10 more seconds. Okay, she's making ozone. Yahi promotion chal raha hai. Okay, come on. Triangle from the right hand. Last 10 seconds. Square from the left hand. Let me pick the winner. Yes, 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 yes. And the one who is doing so perfect among all of you. Yes, ma'am, the one in red. Please. So much focus. Yeah, yeah, yeah. The one in red. With the specs. With the specs. With the specs. You are the one. Yes. Yes, please come. You have to show your talent here. Okay. What's your good name?
Dr. Shiranjini.
Alright, can I have a louder clap for her? Now, what you did on the chair, you need to show to the people so that I'll be unbiased. Yes. Triangle from right hand, square from left hand. I know, people will go with some objections. But I told you she was doing better than everyone. When he bola that she's a perfect one. Alright? So give a loud clap. Millie ma'am, please, please, please. Yeah. Alright. Prize for the miracle team. Everyone, give it up. Can I have a louder clap? A lot of makeup. I'm just kidding. Okay, I'm just kidding. Alright, but I can match the energy. Alright, so you were so excited being here, and while I was having the massage or a session, you was enjoying. Alright, so why we are here? How you are feeling right now right here?
Hello, hi. I'm actually very cool. Kidding. I'm from Malaysia, Dr. Janira. We are here to understand about ozone. Yeah, so that's why I'm here on Dr. Gun's invitation. Yes, I'm a new entry. I have zero knowledge. Yeah.
Are you having a good time here? You enjoying? Yeah, that's the main motive of ozone, that while having lectures, you'll not get bored. You will keep on getting entertainment back to back. Alright. Okay, so without any partiality, I had picked a female character. Let's jump out to the male character. Okay. Alright, so sir, how you are feeling being Ozone family member and why we are here? Please, I need the serious one expressions output a bit little. For next lecture is on reversing diabetes and diabetic complications with ozone therapy and integrated medicine by Dr. Sunita Kaur. With an honor, I would like to invite Dr. Sunita up on the stage.
Good morning, everyone. Good morning. My name is Sunita, all the way from Malaysia, and today I will be speaking, not be hypoglycemic. Then maybe you want to pay attention to the slides in a while. Next 20 minutes, as fast as possible. Diabetes reversal, is it possible? So what is diabetes? Diabetes has been defined by WHO as a metabolic disease where it is characterized by the levels of blood sugar. elevated levels of blood sugar. But what I'm trying to tell you, it is not the elevated blood sugar that causes the problem, it is the insulin levels that cause the problem. So if you have hyperinsulinemia, you get insulin resistance, but here we have patients who are normal blood glucose levels with very high levels of insulin and hence the insulin resistance. That's why we need to look at the insulin levels, not the glucose levels, to reverse diabetes. So the types of diabetes that we have, you have type 1, which is autoimmunity. Type 2 basically falls back to insulin resistance. Type 3, which is a type of diabetes in the brain where dementia sets in. It is also due to insulin resistance in the brain. Type 3C is damage to the pancreas. Any damage to the pancreas, be it pancreatic cancer, pancreatitis, cystic fibrosis, or strokes of the pancreatic artery, can lead to diabetes. The last one, type 4 diabetes, is where patients are normal, they are not fat, they don't have insulin resistance, they are good, yet the HbA1c keeps climbing over the years. And we have diabetes in pregnancy. Now, why do we get diabetes? The main reason why we get diabetes falls back down to genetics, insulin resistance, pancreatic damage, hormonal imbalances, immune diseases, and pregnancy. So is diabetes dangerous? Well, that's why we are here, right? We want to know how to reverse diabetes. So why do we need to control the glucose level in blood? The main problem of HbA1c being elevated is your oxidative stress. And this oxidative stress is the one that will cause thrombus in your arteries. So the main key to reversing diabetes is to reverse this oxidative stress. Oxidative stress will cause cell membrane changes, it will increase blood viscosity, it will increase the erythrocyte fragility and inflammation. So how do we reverse diabetes when we already know the cause? We use probiotics, we look after the leaky gut, we look at the GLP-1 system, we look at the proteolytic enzymes, we lower inflammation, mainly oxidative stress, we lower visceral fat, increase the basal metabolic rate. That is the main key here today. If you can remember one thing from my lecture, is you need to increase the basal metabolic rate. Ozone. Ozone and ozone and ozone. For 20 years, we've been using ozone, and it's the key also to reverse your oxidative stress. So you need to lower the insulin spikes and lower cortisol levels. So the first one, probiotics. There are two types of probiotics here that we are looking at. One is we are looking at the leaky gut syndrome or the gut wall lining, where you want to strengthen the gut wall to reduce lipopolysaccharides. Secondly, you want to increase the butyrate in the gut so that GLP-1 is being produced by the liver. So probiotics for diabetes, we are looking at Lactobacillus, Bifido, Saccharomyces, and your Bacillus species. GLP-1 probiotics are already being bottled, so it's easy to prescribe to patients. Akanmasia is what we need for diabetic patients to increase this GLP-1. And Lactospore is a company in India which produces Bacillus coagulans, which helps to strengthen the gut wall lining. Together with gut wall lining strengthening and the GLP-1 probiotics, you lower inflammation in the gut. Proteolytic enzymes, mainly used for type 1 diabetes, where it helps to reduce the activated T cells. So what type of proteolytic enzymes are we talking about? We have trypsin, bromelain, papain, and chymotrypsin. Please prescribe bromelain and papain and chymotrypsin to your patients in order to lower the activated T cells. Insulin resistance. The key to lowering or reversing diabetes is going to be the insulin resistance. So what is insulin resistance? In a layman's term, I tell my patients, when your cell is full, the insulin receptor will be downgraded. So if you understand that your cell is now full, please don't feed your cells any more food. Okay? So what happens when your cells are full? you end up with more adipose tissue, you end up with liver cirrhosis, and you damage the pancreas. And that's when your insulin levels now start to drop. So hyperinsulinemia is the key. You are looking at insulin levels because of insulin resistance, and you want to reverse or break this insulin resistance because you are trying to save your pancreas. We only have so many cells in the body that can produce insulin throughout your lifetime. So if you want to remain healthy, disease-free, please make sure you look after your pancreas. Now when insulin goes up, something happens. Your oxidative stress inside the fat tissue also increases. Now that is why reducing oxidative stress is so important, because if you make your fat cells inflamed, every cell in your body now is going to be inflamed, because every cell in your body is a biphospholipid layer. So if your fat tissues are inflamed, every cell in your body now is inflamed. So if Dr. Patana was here, he would be very happy with this slide, because sugar is poison and you have to break the insulin spikes. Break the insulin spikes. How to break the insulin spikes? So this is the slide which everybody needs to understand. To break insulin spikes, you need to be in a condition called metabolic flexibility, where the body can use either fat or carbohydrate, switch on and off when the supply and demand is there. So when you have signs of bad metabolic flexibility, you are in insulin resistant, you have high levels of insulin, and you never go into ketosis. Therefore, increasing the metabolic flexibility is going to be the key to reversing your diabetes. So why metabolic flexibility is so important for diabetes? We should never go hypoglycemic, because we can use fat or carbs any one time. So why should any one of us, be it diabetic or not, go hypoglycemic? It now falls back to your metabolic key, your metabolic switch, whether it's turned on or off. So ozone therapy, thanks Dr. Millie. Ozone therapy is what I use before every procedure in my clinic. Ozone therapy is there for patients who are non-G6PD deficient. Why? Because ozone increases an enzyme called 2,3-DPG. And with this enzyme going up, it lowers the glycosylated hemoglobin and it reduces the oxidative stress. So patients need an organ in the body called muscle. Muscle is not there for fun. Muscle is not there to look good. Muscle is an organ, and the reason why we need muscle is because muscle holds your mitochondria. It is the only organ in the body that holds your mitochondria. The more muscles you have, the more lean muscles you have, the lower your HbA1c will be. So losing fat is one thing, but building muscles are more important, because it is this muscle that will utilize the glucose and fat in the body. Now, testosterone therapy is something which is going to help muscle building. If anyone says, I don't need testosterone therapy, you are not going to have enough muscles in your later part of life. So testosterone therapy is not a libido hormone. It is there to build a organ called your muscle, and only with this muscle building will you be able to utilize all the fat and sugars in the body. So now, as we grow older, why is it that we become diabetic or our HbA1c rises? It's because of our muscle mass. As our muscle drops, the hormone levels in our body also starts to decline. We call it menopause and andropause. That's why you need testosterone therapy, because you need to keep your basal metabolic rate on the higher side. So one other key to burning sugars and fats in your body is going to be your basal metabolic rate. Now here, one hormone, thyroid, is there to raise or lower your basal metabolic rate. Now here, we are not talking about hypothyroidism. We are talking about subclinical hypothyroidism. That means all the thyroid levels ranges are still within the range, but clinically you have elevated amounts of cholesterol. Your LDL is on the higher side, your triglyceride is on the higher side, your HbA1c is starting to climb. Okay, the only way to bring down cholesterol and your HbA1c is to increase your basal metabolic rate. The basal metabolic rate can go up with building up of your muscles, or you give them thyroid supplementation. Thank you, Dr. Darren. Thyroid supplementation increases something called lipolysis. So unless you are able to pull the fat out of your liver, you will not be able to feed this fat into the mitochondria to be utilized. Exercise, very, very, very important. Now if you are feeding your cells with glycogen and fat, you need to make sure these cells now utilize the food that it's been given. So unless you are able to move enough to burn that amount of calories which you have eaten, you also need to have resistance training because you need to build muscles. Only then will you be able to improve the fatty liver and improve metabolic flexibility. Now I have patients who come to me and say, I got no time to exercise. I got no time for running, jogging, walking, whatever. So I don't blame them because I work in a clinic also, and most of the time we have to sit, right? So one way which I always tell my patients, if you don't have time to exercise, get yourself an FIR sauna. Because the FIR sauna, 30 minutes every day will burn the fat equivalent to an aerobic exercise. Lower insulin spikes. So whatever we do, whatever is at the end of your fork will be your choice of how you feed yourself. So if you're going to eat carbohydrates, please make sure you wrap your carbohydrates with protein or healthy fats or with a lot of fiber. You can use apple cider vinegar if you want, but never ever eat carbohydrate empty. Always wrap your carbohydrate with either protein or fat to make sure it has a low glycemic index. This is what we are trying to achieve. Everyone can eat 3 meals a day if you want to, but you need to understand that the meal has to be wrapped. The spike of insulin cannot be so high that it cannot come down before the next meal. So what we are trying to do is you have 3 good meals, wrapped carbohydrate, you have 4 hours between each meal, and you have a 12-hour fasting period every day. So when you are awake, your metabolic switch uses carbohydrates, and when you are asleep or fasting, you use fat. So in this way, you burn the carbohydrate and you burn the LDL from your liver. Inflammation, inflammation, and inflammation. It is the key to all diseases. You need to make sure that your oxidative stress is always on the lower side. Hence where ozone comes in, because only with ozone you can remove the glycated glucose or hemoglobin, the attachment of glucose to the hemoglobin by giving ozone therapy. Inflammation and also oxidative stress. Now, this is why vitamin C and ozone comes in hand, because unless you lower inflammation in the fat tissues, there is no way you can burn the fat. So, reversal of diabetes can be achieved when HbA1c is lower than 5.7. I keep it at 4.8 to 5.0 only for one reason, because you want to lower your oxidative stress. HOMA-IR is less than 2.6. Serum insulin levels. Anytime you check your serum insulin levels, be it fasting or non-fasting, it has to be lower than 25. Now, do remember that when we have food, our glucose levels may be normal. Most of us here will be normal. It is the insulin response to the carbohydrates that you have eaten that is the one that is wrecking your metabolic switch. You need to make sure inflammatory markers are on the lower side. There is no dyslipidemia. Muscle mass is optimized. The most important organ in your body is your muscle, and you are looking at 3 kilos of upper limb muscles per limb, 9 kilos of lower limb muscles per limb. 24 kilos of muscles is the minimum amount of muscles that you need to burn sugar and fat. And that's when your metabolic flexibility comes in and you burn sugar or fat with the metabolic switch. So reversing diabetes is actually all about metabolic flexibility. Thank you.
I waited for the intro, you know why? Because Dr. Sunita Kaur is well organized with over 25 years of experience in the field of regenerative medicine. Recently, she has been awarded with the Presidential Award presented by Saram Society of Anti-Aging, Aesthetic and Regenerative Medicines, Malaysia. Big achievement. Can I have a louder clap at the moment, everybody? Dr. Sunita Kaur Ahluwalia is the founder of Walia Wellness Clinic, currently located in Mont Kiara and Kuala Lumpur. Her approach is treating patients at her Walia Wellness to find balance and harmony in cellular and functional aspect of healing. Thank you so much. Moving on to felicitations of the first segment. With an honor, I would like to call upon stage Dr. Karthikeyan and Mr. Manikam to please come up on the stage to felicitate first segment. Okay, you guys can be there. Yeah, thank you. Dr. Karthikeyan, come up and receive the mementos. Dr. Resicivia, please come and receive your mementos. Time to have Dr. Sunita Kaur.
Till we wait for him, we are taking another lecture. Okay? Acha, two spinning. Okay, some surprise for you. We have got some spinning wheel game. It's going to be, let's see who's the lucky one.
Ma'am, one more time in the mic.
So we have some great surprise with a spinning wheel game. Let's see who will receive the first gift. Yeah?
Okay, there is no script about getting a winner. This is a random call, and the people who are here from so far, so long, time to receive some gifts as well, because we don't need that you guys go empty-handed. Alright, so, are we all excited? Yes. No feedback. Are we excited? Yes. Alright, everybody, fingers crossed. Let's see who's the first lucky winner. Let's spin the wheel. Alright, now when you guys will shout stop, then we'll stop it. Come on, 3, 2, 1. Alright, and Dr. Vikrant Yadav.
There? Not there.
Not there?
Chance gone. Vikrant Yadav है? तो आओ ना.
So you was waiting? जब तक बुलाएंगे नहीं हम जाएंगे नहीं? Alright, can I have a louder clap for the luckiest person? Dr. Vikrant, what's your name? Asha Vikrant, your name. Alright.
Since he's the first one, he gets two together. Okay?
Whoa. Alright, moving on. Alright, yes. Photo, because you gave two gifts, that's fine.
One is from autoimmunity care and the Ozone Forum of India. So, thank you.
Thank you so much. Thank you so much. All right, moving on to the second round. Stop.
Sir,
Dr. Dilip P. Kulkarni. Is he here? Yes, he is. He's stepping up so proudly. I'm the second luckiest one. Yes, ma'am, please.
so another lucky winner, the first segment, 2 gifts together. Second one, thank you, sir. Ozone Forum.
Thank you so much. Thank you so much. All right, so now I hope you guys are having a good time here. If you are enjoying and getting some entertainment in between, give a lot of clapping for yourself. NK Nair. Dr. Pradeep, please grab stage. Dr. Pradeep is Chief Medical Officer and Head Research and Development Miracle Integrated Healthcare Pollachi. Visiting Professors Excel Medical College of Naturopathy and Yogic Science, Erode. Medical Director Research, American Academy and Research, Pune. He has authored more than 70 research papers in peer-reviewed international journals. A big hand at the moment, a big achievement. As well as 23 chapters in national and international textbook, and has served as one of the associate editors in textbook of clinical naturopathy and yoga. Dr. Pradeep, please.
Good morning, everyone. Thank you very much for that introduction. So my topic is straight away on integrative oncology, how we will be using ozone therapy. So we use a lot of other therapies as well while we treat cancer patients, but because the topic is ozone and integrative medicine, so we'll be discussing more about what kind of ozone therapies we'll be using in integrative oncology setting where we come from. So I come from Miracle Integrated Health Center, so we are an exclusive integrative oncology setting, though we treat other patients as well. We are known for treating cancers. So before we start the entire thing, if you just look into one common concept, like we all are here, we are speaking about oxidative stress, we speak about so many things. But are we getting a disease because we are not having a drug? We are not getting a disease because we are not having a drug. We are having a disease because we don't give adequate amount of nutrients to the body. Because if you look at the body, if you look at me or every one of you, we are just some biochemical material. It is protein, vitamins, minerals, carbohydrates, everywhere it is there. So inadequate supply of these minerals or the metabolic request for the body is something which leads to the disease. But whenever such things are happening, we will be supplementing with drugs and expect the body to respond, which is not the case. So when you come to cancer, it's a different ball game because everybody thinks that, okay, it's good to have a diabetes over cancer, right? Like we don't feel like we are going to die to have a diabetes, but the moment you are diagnosed with cancer, even if the patient is asymptomatic, they get a diagnosis with cancer, at that point of time, everybody will be thinking that the days are being counted and they're going to die. So, but is it that a real case? And the whole oncology, if you look into, we are having all cutting edge technology starting from chemotherapy to the immunotherapy, different types of radiations it is available. But still if you look at the statistics every year, still we are increasing. In every 4 minutes, one woman is being diagnosed with breast cancer. Breast cancer has taken over the lung cancers, the leading cancers in India. And India is almost reaching how cancer comes in our body. This is a paper published by Thomas Seyfried, one of the leading medical doctor from Boston, who speaks a lot about mitochondrial origin of every disease including cancer. And if you just look into how the cells divide, and we all know the nucleus, we say that's a fundamental unit of a cell. And the only job of nucleus is to divide and multiply into different cells. But we also have mitochondria, which is a powerhouse of the cells, which is actually an important organelle inside the cell, which helps us to function. And if you just look at the tumor cells, the entire cells, we have tumor over here. And if you just look at the other cell where we have it, where the nucleus, the third image I'm telling, the nucleus is something where the nucleus is having a cancerous nucleus where the mitochondria is normal. So whenever there is a cancerous nucleus and normal mitochondria, the cell still divide as a normal cell. Whereas if you have a cancerous mitochondria and a normal nucleus, the cell will divide as a cancer cell. So this is an experimental study they have done in a clinical, in an animal setting, but this is the same thing which is happening inside our body also. But the entire drugs, we are all targeting the genes, the genetic instability or the DNA instability which is happening in case of the cancers. It is actually, we are praying to a different god. In a temple we are calling Allah, or in a mosque we are calling Krishna. So it is like it will not work if you just target, even though the genetic instability is there. But if you want to heal the cancer, that is why people come up with a remission, relapse in 6 months. If you take out one mastectomy, in another 6 months they are having in the same place, or they are having in the other parts of the body, or they get a complete remission for 6 years, then again they come up with another cancer in some or the other place. Because we are not correcting the metabolic disturbance inside the body. So in Miracle, what we do, basically, this is a paper published of ours in Frontiers in Oncology this year. What we do in Miracle, basically, we do not target all the kind of, the modern medicine approaches in cancer, or the conventional approaches in cancer. Basically, it targets what happens here, that is at the cellular level, like what your genes are changing, how it is responding. But every one of us sitting here will be having some cancer cells inside our body. Because if you see the first line of attack, where all of us have some sort of psychological stress, for sure. Some of the other psychologists, we all have mitochondrial dysfunction. Like for example, if you just have an echinacea nigricans, it is just showing there is an insulin resistance inside your body. Or if you get some skin tags in the body, again it is showing there is something to do with your dysfunctional metabolism. And moving ahead, since we cannot produce vitamin C inside our body, every day are we having vitamin C, and also there is a concept called cancer is a modern day scurvy. And the third thing, the tissue hypoxia. The cancer can only divide in a hypoxic environment, and that is where ozone plays a major role. And the acidic microenvironment around the tumor. The more the white ingredients go inside, it becomes more acidic inside the body. And then the oxidative stress, the excess amount of free radicals formation in the body, and the dysfunctional autophagy. Even though, like when we say people, they'll have six-pack, but they'll get into cancer. Because physically we are healthy, but metabolically we are not. We may be eating only 2 meals a day, but the first meal will be 6 o'clock in the morning, the last meal will be 11 o'clock in the morning. We are not maintaining the circadian cycle. We may be exercising, we may be doing yoga, but it doesn't work because we are not fitting that into the autophagy is getting dysfunctional inside the body, and which leads to the trigger in the stress at the cellular level, which leads to whatever you see in your microscope or whatever the studies. We take one gene and target that gene because that is how we develop drugs. Or we take one particular ashwagandha, take one thing out of ashwagandha and target certain cellular pathways, and it is not going to, it is like an elephant and a blind man story. We are never addressing the cancer as a whole. But Miracle, what we try and do is like address this thing as a whole, like where you have to target the psychological stress, the mitochondrial dysfunction need to be corrected, the vitamin C deficiency need to be corrected, the tissue hypoxia need to be corrected. There are many ways and means which we do that, and this is like the metabolic program what we do, starting from the keto diet or sodium bicarbonate applications, the alkaline juice therapies, counseling, acupuncture, and you can read it out there. So this is targeted directly at the root cause. And at times, patient will still remain or having cancer in their PET scan, but eventually their symptoms improve and eventually they achieve a remission also of cancer, and that will be a sustainable remission. The patient is able to live how they can tackle cancer without any fear. And if you move forward, why ozone therapy in cancer? If you see, the first thing, as I already told, the oxygen regulation is a key in cancer survival. Cancer can survive only in a hypoxic environment, and that is what Otto Warburg also got a Nobel Prize for. So, considerably, continuously when we are boosting the oxygen availability in the microcirculation of the tumor, it can halt the tumor growth and metastasization. Second one is like, ozone also induces a temporary oxidative stress which is inside the body, which can protect against persistent oxidative stress for the particular thing, and also the immune modulation. So that's why we use different doses of ozone. Like we have all the 3 types of ozone which will be required, because cancer is also a fungal infection, cancer is also something to do with your immunity, cancer is also something to do with the inflammation inside the body. So we would be requiring all sort of applications which is required to address the tumors. And this is a recent publication in 2022. Again, animal studies. Why it is in animal studies? Because we will not be allowed to do in human studies, because there ends the factories. So moving forward, what are the ozone therapy protocols we use in Miracle for different programs? Like if you see, we use rectal insufflation, On alternate days for all the patients. We use vaginal insufflation, especially in those patients with cervical, uterine and ovarian cancers. We use bladder insufflation in prostate, renal cell carcinomas. We use funneling locally on the areas of the cancers, as well as if there are fungating cancer wounds, we'll be using that. We also use local ozone injections for metastatic pain. Ozone oil gargling, especially for oral cancers, and ozone saline we will be using once in a week as a metabolic enhancer for the patient, and we use minor auto majorly for for immunomodulation and cytotoxicity, and the minor ozone therapy we will be using especially when the patient is having some sort of fatigue, or if you want to do some immunomodulation. And ozone water drinking is advised every day, but of late we have started using hydrogen water drinking in our hospital instead of ozone. But ozone is also good. Millie will break me if I say. Then ozone sauna, which is very important detox, especially when we do chemotherapy for our patients. So we do the chemotherapy 1 day before chemo. The patient will be undergoing a fasting, a juice fasting, so that the cells will be prepared for a low dose chemo. So we don't use a conventional higher dose of chemos in our hospital. So next day we'll be using a very low dose chemo. Like let us say if you are using a bevacizumab like 600 microgram or 1200 microgram, we'll be using around 100. So with the fasting prior to the chemo, on a low dose chemo itself, we can achieve the same results. And the third day, again the patient will be undergoing a detox for removing whatever is a circulating remnants of that particular stuff is there inside the body. And also in terms of ascites, water retention in the body, ozone sauna is also employed. Then ear insufflation, especially for brain without hemorrhagic lesions, we'll be using. And Boto is also for lung cancer or any kind of respiratory infections what the patients get. This is something which is directly what we use as anti-cancer applications. And adjuvant applications what we will be using is like, especially when patients come from outside, like they might be doing severe heavy doses of chemos or radiation, there will be a lot of skin discolorations inside the patient, nail and other stuff, so we will be doing bagging. And even neuropathies, this bagging is very helpful. And scalp ozone, so especially even though we are doing a low dose, we just still advise our patient to go for a scalp ozone at alternate days or once in 3 days for the patient. Especially some people even with low dose of chemo, they tend to have hair falls. And then what we will be doing is scalp ozone injections and ozone sauna and steam. This is especially for post-chemo radiation revival, as well as to revive the water retention, and rectal insufflation, which is a must, as I told, alternate days we'll be giving. And ozone vacuum massage is also being used in our setting when we do ozone therapy. So these are the different therapies which is not standalone. No therapies in cancer is standalone. Be it chemo, be it ozone, be it any IV vitamin C, every patient is different, so we devise a protocol for every individual patients at our place. And why it is very important for us to shed our egos and come together. In our hospital, we have an oncologist, we have a general physician, we have an naturopath, we have a homeopath, we have a siddha physician. Why we are able to come together is because cancer is so dreadful. So this is what we get in our place, because most of the patients come to our place after going to allopathy, homeopathy, Tirupati and then naturopathy. So they will be almost having no hope when they are coming to us. So we need to somehow find a solution for that particular problem. They will be with a lot of agony, they lose their money, they lose their mental capacity when they come to us. So it is like they come as a last hope to us, and whatever we can do to revive them. So that is something like, as a naturopath, that is an advantage for me, because we believe in the root cause of the disease rather than addressing the symptoms. So that is where we are able to try and revive such kind of cases. Many people are not there, but none of the patients come and vandalize our hospital because they're dead, because we make their life so comfortable, like they will be having the highest quality of life while they're living, and also achieve cancer remission also in many patients. So these are some different cases what we deal with. So that is why we should, as a community, as a family, why we should come together irrespective of our disciplines. And OFI is the only place where I see that we have an open communication between all the experts irrespective of which discipline we belong to, and that is something which is we have to take care, because cancer is so dreadful. Because even if you are ready to get a heart attack, you can have a stent and live for another 5 years. But cancer, even we do not know whether we really die or not, because we believe one part of science that if you get a cancer, you are going to die. And that is why even in a theater, when you want to go to watch a movie, the first thing what they show is like, smoking is injurious to health and you may get cancer, because that is predisposing the cancer feeling in your mind. If at all you diagnose with cancer, you are going to be a part of that particular chain where we are going to put our organs at stake. And moving ahead, these are the other therapies which we use alongside ozone in our hospital. High dose vitamin C, molecular hydrogen, we'll be using ozone therapy. Chelation is being used. Vitamin D is, like Dr. Renu Mehta's protocol, is being implemented for all our patients. Then we have coffee enemas, colon hydrotherapies. We have different sodium bicarbonate applications, and we use cannabis insufflations as well as cannabis doses as well. And along with that, we also use some naturopathy therapies, starting with diet. Because of want of time, I cannot explain. Hydrotherapy we use like packs for certain conditions, and we use physiotherapy for the patients, especially for brain tumors who cannot move. Then acupuncture is a regular phenomenon for, we use Western acupuncture, and then we use yoga therapy for all our patients. Breathing is the key because again tissue hypoxia you can tackle, and mud therapy is also used for our patients, and this is why we use that particular treatment. And other than this, in Miracle what we have is something called oncothermia, modulated electrohypothermia, which is India's first hypothermia machine in India. So where without radiation, without any surgery, without much invasiveness, we can handle cancer patients. That's why when patient comes, there is nothing can be done. It's completely blocked. There is nowhere we can do something. Oncothermia is one of the hope where we can see. But again, as I told earlier, nothing is a standalone thing. We have failed even when patients take oncothermia because many a times cancer is very dreadful. But over the period of time, based on our experience, what we learned is like 70% of cancer patients we can cure if they consistently believe in their body, not even doctors. Only 30% of cancers are dreadful, which is definitely problematic, which we cannot control even if something comes. But 70% of cancers can be cured, and cure in the sense it is not something not seen in your PET scan. Many a times PET scans it is completely black, but still the patient is alive and can able to do whatever they want to do. And then we do something called hyperbaric ozone, and electromagnetic field application is also there, and we use near infrared radiations for pain and far infrared radiations for detox. Then we have something called hydrosun. Yesterday Dr. Sudha was speaking about the chakra healing, and this is a modern application of chakra healing. We have 7 colors where we can use that for which plexus you want to activate. And then prospectively we are planning to bring high density focused ultrasound, which is going to be a kind of an ablation technique for cancers. It's a very costly affair. And then supplements, if you see, I'm not promoting any brand. This is something which we use at our place for metabolic maneuvering. The metabolic repairing we do at our place, because this is something which is constant for the patient, because as I told earlier, we are not getting a disease because we are not having a drug. Like if you don't want to get cancer, can we have like chemotherapy drugs and prevent ourselves from cancer? No. But you can reduce your inflammation, you can improve your melatonin levels, you can improve your serotonin levels, you can reduce, you can put a resveratrol for the patient, you can put vitamin C every day into the body as a preventive measure, because body repairs only through metabolic outcomes. Like you have to give what is body asking for it. If you want to be relaxed, body is asking for magnesium, try and supplement that. So if your body there's water retention, body is asking for some sodium maybe. You have to try and find which can be beneficial for that point of time. So these are used for different purposes based on looking into their metabolic profiling. And these are some cases like where they have benefited in our hospital, like the PET scans you can see. So it's the lung cancer with skeletal metastasis. This is again a high-grade glioma. So where we got 30% reduction, but the patient do not want to stay because they cannot. People are intolerant for the scans because for them it is like an Aadhaar card. You have to make them believe that you are alive or you are going to leave. For that they need something, an image of their brain, image of their stomach. They are not ready to believe the metabolic health in per se. They want the physical health, which is the primary thing, unfortunately. And this is an infratentorial meningioma, which is right there in the medulla. But again, this person went for surgery later. But it was an impossible surgery which they have done in Apollo. He survived through that surgery, but initially people were not ready to put the knife on him because it was right in his medulla. And then we use also something called dermal scan as opposite to the popular scans. Dermal scans basically can find the hyperthermia in the lesions. We can find out if there is any benefit in our treatment protocols what we're giving. And this is one like fungating breast wound. It is completely healed. You can see this in 2 months time. She's actually now, this patient is from Hyderabad. She is completely only having a brain mets with a mild lesions in her breast. But again, asymptomatic patient, very positive. She has undergone so many, she has actually undergone the chemotherapy cycles with us. She has never taken chemotherapy outside, no hair fall, she's walking from the first day. And this is how the healing happens. And this is our team. And why we could do this is because of Dr. Manikam here, who's sitting, because he's not a doctor. So because he's not a doctor, he could be looking into what is the real problem. Then, because if I'm a naturopath, if I want to establish something, I am having a personal interest that naturopathy should come first. Or if an allopathy is doing, everybody will be having, okay, I want my system to be first. So other things like you see integration is happening in different hospitals, big hospitals of oncology. But it is something like that, okay, you do yoga in that end and you do massage in the 7th floor, but I will do what I want to do. I will cut everything first, then for that depression you give yoga, or that depression you give cannabis. So here in this hospital, what we do, I can, as a naturopath, I can ask with my oncologist how much dose I should be requiring for my patient. Or I can defer my patient from chemotherapy, I can take a call. And same thing, oncologists will not be sitting on the patient's head and telling that, oh, if you're not taking chemo, you're not going to do well. So oncologist also is very conscious, because that is what is required. Like we all are students of science and we have certain disciplines we know very well. I cannot be an oncologist and an oncologist cannot be a naturopath, but what we can do is like we can work together. So today we have 5 yoga naturopathy physicians, there are 1 oncologist, a general physician, and we have 2 homeopaths and a Siddha physician working, and we are doing very well for that, and this is one of the things which we give to our people, miracle drink, the vitamin C drink, which we, like vitamin C, which is on high dose, can prevent against cancer. So this is what we do, and thank you very much for the opportunity also for India and all of us.
Wonderful insight. Alright, before jumping on to our next lecture, I got a request that we need a gaming session. Alright, so everybody with the cell phones? Now raise your cell phones up in the air, everyone. Alright, cool. You're not feeling odd now in between all of them? Yeah? I'll help you. Now see, what's the game? Put your hands on. What's the game and how we have to play? A minute to win it. Alright? Definitely we'll have a big bada prize for this session. How we are playing this game, huh? कोई दिखा के ले रहा है, कोई छुपा के ले रहा है, कोई किसी के साथ कनेक्ट कर रहा है, किसी ने 3rd फ्लोर पे जाके लिया है, किसी ने 2nd फ्लोर पे, किसी ने चेयर पे. Yes, I got the lip sync. Selfie लिया है. Alright, so you will get first 30 seconds. Okay? In this first half, using your cell phones, you have to get maximum number of selfies. But the rule: don't waste आजू बाजू वाले का time. Play it on your own. Okay? खुद का लेना है. Alright, you are the contestant, no? They are not. They are just anybody with the burst shot will get disqualified. You want to rotate here, there, sit, stand, whatever you want. Use limelight, be here. Feel free. So are we ready? Yes. No feedback. Yes. Are we ready? Yes. Alright, come on. 30 seconds and your time starts now with a bit little music at the background. Any music, any music. 30 seconds. Happy wala, sad wala, cry wala, crazy wala, angry wala. Look, that's for the prize, huh? Come on, give it up, give it up, give it up. Yes. 20 seconds left. Very good, very good. Alright, changing the angle, huh? Very good. 15 seconds, yeah, keep going, every second matters. Okay, let's hit the countdown, come on, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Alright, thank you so much. I have given you the hint, happy, sad, cry, crazy in between, कि उस expressions को copy करना है. But आपको पता है कैमरा पर्सन ने क्या compliment दिया आपको? Horrible expressions. And you guys are doctor in every picture. Randomly, hold on. Randomly go pick anybody, click picture, and music in the background. Come on. Grab anyone, click, move ahead, just increase your count. Don't stop. Yes, keep going. Alright, attacking focusing on me. Perfect. Very good. You got the nearest one, huh? Alright, very good, guys. 20 more seconds left. Yes, keep going, keep going, keep going. Let me see that. Who is worth for the prize? Yes, very good, very good. Ma'am को celebrity वाला feeling आ रहा है. Oh my god, oh my god, oh my god. Thank you. Yes. Last 10 seconds for you guys. 10, 9, 8, 5, 4, 3, 2, and 1. That's it. Time's up. Back on the floor, everybody. Give it up for yourself. And to other people, give a louder clapping for all of them. And I need all the contestants to please come back to your place. Nobody's allowed to say, this is not my number, wala chashma, jaldi se get up ho jana hai. It's okay, doesn't matter. Aapne ek selfie bhi liya hai, I'll count that. Come on, quickly. Yes. Now, count the number of selfies. First half and second half. Count totally. Come on, आप जो पोज देकर बैठे थे, but आपके पास कोई नहीं आया फोटो लेने के लिए. So I'm so sorry in both the situations. Alright, जिन्होंने मेरे सबसे बड़े सेलिब्रिटी थे. 8, only 8, and telling me so proudly. 8, 32, 20, 19, 22, 34. जिसमें से पीछे घूमने वाले, yeah, the counted, 32. 38 plus 13. Okay, I'm the maths teacher. मेरा maths बहुत weak है यार. All right, that's 50, 51, 50. साथ मिल गए आपस में? Maybe. 21. I'm very proud. That's why I told you I need some experienced person as well. Yeah. All right, and you was leaving the floor. I'm feeling so proud now. Yes. 16, not bad. See, having this age and beating your counts, my God, at this level. Okay, so first of all, ma'am, I was having 2 prizes. One is for some young ladies and one is for another young ladies. They are not seniors, yes. Yeah, please. Please come in the center, yes. The highest count is, you said 81. And after, it's okay. I trust you. Alright, and you're having 60. 16, okay. Lower than, I guess, maximum. Nah, she's having the least count, 8, right? Alright, more than 30, 51. More than 50, come on, give it up. What's your name? Dr. Devyangi and Dr. Reena, आज पता चल गया आप फ्री टाइम में क्लिनिक में क्या करते हो? Alright. No, you are expert. आपने बहुत मेहनत की है. Now, yes. I need 2 more prizes because I need both of them to get. They are the Jai Viru की जोड़ी लग रही है मुझे. Yes. Sponsors by Right Wing. Winners stay there. All right. Now. Let me. Now you will get a punishment. Mutually decide करना है एक pose इन्हें as a punishment देना है. आप ही दीजिए. Come. Punishment. Yes, ozone wala. Yeah, very good. In the camera. Capture the moment. Yes, and we'll capture it. Okay, now you guys can clap for Saranya ji because मेरी लिस्ट में हर बार losers prize, winners prize नहीं लेके जाते हैं, कभी losers भी ले जाते हैं. So now I'm having 1 more prize. Can I have the gift hamper?
Since sir has arrived, I think I would like to have a big round of applause for Mr. Chauhan, the chairman of Ozone Forum India and chairman of Bisleri Charitable Trust. Digna
निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा सर्वकार्येषु सर्वदा सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
So today we welcome our very own chairman of Bisleri Charitable Trust and Bisleri International Private Limited, the man who needs no introduction in the world of creating legendary brands. As we enter 23rd year of promoting ozone therapy in India, Sir believes that ozone therapy should be used as a cost-effective healing tool, and he continues to extend his full support in making ozone part of each and every household in India. Bisleri Charitable Trust is also committed to give back society a clean environment, so they have initiated many projects like bottles for change, rainwater harvesting, at the same time plastic, which is not waste. How we handle the plastic is bad. So he puts an emphasis on that. I request Sir to speak few words of inspiration for the audience.
So, is getting to be more popular. Had any impression that ozone is bad. You talk to your doctor, he will say no. And he doesn't know why. So I'm hoping that all the people we are in contact will spread ozone goodness. So you are the ambassador to move ozone in the mainstream.
Thank you, sir. Thank you. That was. I request Mr. Manikam. You can have a seat, sir. So, along as in Bisleri Charitable Trust Initiative, we also have our one more trustee of Bisleri Charitable Trust, Mr. Parag Bengali. Sir, kindly accept a small token for being our advisor. Thank you. And we also have Mr. Ashish Gumasta and Ami Gumasta, who've been really promoting ozone therapy, and Ami Gumasta, who's been really practicing or taking ozone therapy on herself and making it part of more and more charitable institutes like Hemendra Kothari Institutes. And so thank you for coming. Okay, many more to come, but now
I now welcome our guest of honor, Dr. D.R. Karthikeyan sir. Dr. D.R. Karthikeyan is a farmer turned, lawyer turned, senior police officer turned, human rights activist turned, promoter of interfaith harmony, and environmentalist. He held very high position in the government of India, including Director General of National Human Rights Commission, Director of Central Bureau of Investigation, and Director General of Central Reserve Police Force. He has visited over 150 countries, participating in and addressing conferences relating to various subjects of human welfare, including fighting violence, crime, and terrorism, and promoting environment, human rights, and interfaith harmony. He is an ex-director of CBI and DG NHRC, president of Matters Media, publisher of Life Positive, magazine of Holistic Living, president of NAAM ULABAR, a farmers magazine, president of Bharat Biofuels Growers and Manufacturer Association, president of National Agricultural and Awareness Movement, President of Brain Trust and World Community Service Center. Dr. Karthikeyan has been an OFI advisory board for the last 2 years and have helped us to promote ozone in many renowned institutes like Art of Living, Khana Santivanam, where heartful meditation is taught, Pyramid Valley, Bangalore. He was instrumental in introducing ozone therapy. Sir, I request you to say word of wisdom to our audience.
Namaste. Pardon me for my bad throat. Traveling from Kumbh Mela to many places last 2 weeks, I came here. I am not able to express myself, but anyhow, I'll try now. My admiration to Mr. Ramesh Chavan for bringing ozone to India. I also admire Dr. Rajkumar and Mr. Manikam for carrying forward the power of ozone with a lot of confidence, even during times when practicing ozone was considered a crime, because they were convinced about the validity and they helped heal thousands of people, particularly in the South India. I am here to try to learn more and more about ozone and its power and healing therapy. I will only read out what I wrote to the Honorable Prime Minister of India during the COVID. That was in April 2021. I said, I am conscious that I am staking my hard-earned reputation for common good in taking up this project. You know, at that time it was considered superstition, and there were doctors who were healing, but they were doing it secretly because they were liable for prosecution at that time. At that time I found Dr. Rajkumar and Dr. Manikam boldly through their therapists saving hundreds of lives, thousands of lives. I said it's a phenomenon, it is understood Prime Minister of India. With a phenomenal memory, you may recall meeting me a number of times. You will certainly recall me as T.R. Karthikeyan, former director of the CBI, and also known for the successful investigation and prosecution of former Prime Minister Shri Rajiv Gandhi. These days, victims of COVID are unable to get admitted to hospitals, and even some of those who got admitted in hospitals suffer for want of oxygen and medicine, and have to pay several lakhs of rupees whether they get recovery or not. I find in and around Coimbatore hundreds of recoveries in 3 to 8 sittings of intravenous ozone therapy combined with the administration of vitamin C and other supplements. It takes about 3 hours per sitting with minimum expenditure at that time I wrote. I have seen it happen at Miracle Wellness Clinic at Pollachi through established in the memory of the legendary G.D. Naidu Garu, through Dr. Rajkumar at Ozone, treating successfully symptomatic patients and post-COVID treated patients for quick recovery. This is what I wrote to the Prime Minister at that time, when people are scared of treating people with ozone. Okay, I have been writing about this phenomenal treatment to Union Health Minister also. I am happy to learn today that the Ayush Ministry of Government of India is also seriously considering this mode of treatment. I understand that the National Institute of Naturopathy, Pune, under the Ministry of Ayush is imparting training to the naturopathy doctors on the use of ozone for various ailments. And I said, refer to Dr. Saranyan, Medical Superintendent, R.K. Nature Pure Hospital, and the governing body member of NAM. I also learned ozone for India is treating COVID patients and published papers in prestigious index journals. Hence, it will be very easy to implement this system involving doctors trained by NIM. In this process, I see a definite possibility of India emerging as a leader in the world for effectively treating COVID-19 and similar pandemics with our own effective, accessible, and affordable treatment. I am attaching here with a letter I wrote to Honorable Health Minister last year, that is 2020. I am bringing this to your kind notice as a concerned citizen of the nation. I am taking the liberty of endorsing this communication to Honorable Health Minister, Finance Minister, and so many others, whom I have had the privilege of knowing them well for years. So, ladies and gentlemen, then I wrote a paper, understood newspaper, newsletter I call, on necessity and the inevitability of encouraging our traditional systems like Ayurveda, naturopathy, herbal medicine and all that, because I wrote another letter saying 50% of the people cannot afford enter hospitals. They are so expensive. No bed available. And those who go in, not all of them came out. After spending lakhs of rupees, half cured or even bodies coming out. Nobody could say about that. But they said, oh, what about this validity of these things? What is the guarantee and all that? Yes, in a conference on naturopathy in Pune, 2,000 naturopaths were there. I was asked to speak. When I spoke, I said, Dr. Manamohan there in the audience. He was sitting somewhere in a corner. Called him to the diet. Please tell, 500 people at that time, the regular hospitals beds were not available. Even with money and influence, you can't get bed. So the government sent me 500 people to Naturopathy Hospital, Government Naturopathy Hospital. And he said, he addressed them, he said, with data, all the 500 people recovered only by naturopathy treatment. I'm telling you, all these possibilities are there. Unfortunately, the superstitions, these things don't work. So I wrote to the Honorable Prime Minister about all the details. He referred it to Niti Ayog. I met Dr. Vinod Paul, member health, he is a cabinet minister's rank. Number of times on this. First he said reluctant IMA is against it, pharma is against it. Then now there is a change in the attitude of the government. I want to say I'm happy about it now, because Honorable Prime Minister himself believes in these things now. I said that time, yes. I said, can you say that everybody who went to a 7-star hospital came out alive? I said, I give you a list of people, go and see. It's just medicine. Anyhow, the good news is the government have accepted. There is a draft integrated medicine policy being circulated. That means, in principle, they accept it now. Now, ozone is being practiced also everywhere. I'm happy. The credit first goes to Mr. Raveshan. You brought it for some other purpose. You may be doing it for some other purpose, but at the same time, through Dr. Manikam and Rajkumar, the credit goes to them. Maybe many others, I'm not aware of that. Now the nation has accepted. The world is not looking at it. This is the only way you can give health for all. What is the partial? What is the goal, the United Nations goal? Health for all. Affordable, accessible treatment. This can go to any number of people now. I'm happy you are all committed. You have shared how you have been practicing it successfully. I am fully committed to it, so I am with it now. As long as the passion I am committed, I am with it. I think we will make it available everywhere. Otherwise, the purpose is not only to few people who can afford it. It has to go to every citizen. All over the world, ultimately, the movement will start from India. Ramesh, Manikam and Rajkumar will certainly be given the credit for that. Thank you very much, Dr. What a wonderful lady she is. So committed to it, so dynamic, and I admire the Forum of India also. And congratulations to be on the path. Be more committed. Go ahead with confidence. Heal the planet. Thank you. Namaskar.
Thank you, sir, for your kind words. Please accept a small memento from Ozone Forum of India. I request Mr. Ramesh Chauhan, Dr. Milisha to hand over the memento to Dr. Karthikeyan.
Sir, it's for you. Please hand over the
We welcome Mr. Manikam Mahalingam, who is our special guest. He is a chairman of Miracle Wellness Clinic. He is a chairman of Managing Director of Shakti Sugar, chairman of Managing Director of Shakti Auto Components. We call him as the Miracle Man, as he was instrumental in introducing ozone to Mr. Chauhan. His special interest in liposomal vitamin C has made us available with ready-to-drink, protein-rich liposomal vitamin C drink called Miracle Drink. Miracle Wellness Clinic is one-stop integrated clinic for cancer. I now request Mr. Manikam to say few words on ozone therapy.
Good afternoon, everyone. Good afternoon, everyone. It's a great pleasure to be here today in the seminar with Ramesh Bhai being there and Dr. Karthikeyan Dr. Milisha has done a great job along with Jignesh Academy on getting this organized, running it every year. And Ramesh Bhai has been really supporting Ozone. And this is a journey I've been on for the last 25 years, literally. And a lot of things. I mean, Dr. Karthikeyan was talking about COVID. Actually, in COVID, we killed people. The COVID didn't kill people. What happened was one particular case that we treated. What happened is, if you analyze the COVID, one of the first papers which came out in the world on COVID, the data was supplied by the medical clinic. The main problem was the roller formation. The blood actually went into severe roller formation, so there's no transmission of oxygen from the blood to the body. And what we were doing is actually pumping a hell of a lot of oxygen into the lungs, hoping that the blood will pick it up. The blood was not picking it up because of the roller formation. We were tearing lungs into pieces. That's why if you see the first stage, everybody went in for a huge number of ventilators. And the second phase, nobody wanted ventilators. So we actually gave just one dose of vitamin C and IV ozone. We were able to reverse the whole roller formation in one sitting. We were able to get out. In fact, my son had severe roller formation. We gave him 40 minutes of ozone and 30 grams of vitamin C IV. In 1 hour, the whole roller formation was gone. So in fact, that's what we were pushing in, and we were able to get a lot of people come out. In fact, one of my friends was at 40 liters of oxygen. We gave him vitamin C. In fact, that hospital didn't even have ozone, so we just had sent vials of vitamin C, gave one IV, and within a day he came down from 40 liters to 20. The next day he was discharged. So the roller formation was the main problem, and people were not looking at the root cause. They were actually looking at symptoms and putting people on ventilators and a lot of issues. And in Coimbatore, one of the hospitals was complimented by the Prime Minister's office because we had the lowest mortality, lowest intubation and lowest admission into ICU. That was the ESI hospital in Coimbatore. And the only treatment we gave there was 3 packs of miracle juice a day for a patient. Every patient we in fact gave miracle juices free to that hospital. And just with this they were able to show a difference, and that was rated the best result hospital in India. The Prime Minister's office called the Dean of the hospital and congratulated them for having achieved this. So this is all looking at basic sense and basically how we can address it, and Ozone is a great way of doing that, and I'm very happy that Ozone Forum of India has been doing this for the last 23 years, and the seminars which are being organized with all the doctors. I mean, today I see various walks of doctors, not only allopathics, we also have naturopaths, homeopaths, everybody getting together and working on a common cause. I'm very happy that I have this opportunity to address all of you, and wish you all the best. Thank you.
So many things, right? Okay. You're making cables. Yes. Mr. Rajkumar.
Letter addressed to the Prime Minister on this and integrated medicine. Prime Minister referred it to Niti Aayog. Niti Aayog is only the highest policy formulation body on any aspect. So I met Dr. Vinod Pal, he is a member. Health Niti Aayog is the cabinet minister's rank, is the ultimate. He asked me, sir, after distinguished service in police, CBI, CRPF, why are you after this? I told him, doctor, I have no personal interest in this. But I can't see people dying like flies all over the country. Whole families getting wiped off. And even people who can afford it cannot get entry into the hospital. No beds available. No oxygen in the hospital. And medicines were not there. They were in black market, as you all know very well. I can't see thousands of families just getting wiped out. The whole family is wiped out. But I see in Coimbatore with these gentlemen, they were running with, of course, naturopathy along with ozone, you know, IV ozone, IV vitamin C and all that. They're recovering, miraculous recovery in 10 days' time. So why can't the government take advantage of this? First he was telling IMAs against his pharma industries and all that. I said all over the world, the industry is preventing this to coming up now. Then, of course, I met the Honorable Minister for Health, Minister for Ayush Minister, and many people and all these things. Over a period of time, there's a change of heart in the government. Fortunately for us, we have a Prime Minister who believes in these things. Inherently, he believes in all these things, yoga, meditation, naturopathy and all that. So there is a big change of heart. So integrated medicine policy is being circulated now. That means, in principle, I agree. It will be a different policy later on. And in new IIM hospitals, they are introducing a department of integrated medicine. So that where the students go for study, they also know there are other possibilities. Otherwise, people coming only in the Western system, they think all the other things are superstition. There's a big change of heart, there's hope. I do hope this going to start in India, it will spread all over the world. That will be again like yoga and meditation. India's contribution to the world will be ozone therapy. Thank you. Namaste.
Thank you, sir, again. Okay. So next we welcome Mr. G.D. Rajkumar, who is our special guest. He's currently a Managing Director of G.D. Weiler Private Limited and also UMS Technologies Private Limited, G Plus Private Limited. He's also a trustee of G.D. Medical Foundation. Mr. Rajkumar has spent his early years in Germany by doing apprenticeship in system and mechanical techniques. He's a firm believer of learning with experience, and that is how all their education institutes work, with the motto of destruction for construction. This is my favorite line. Okay? Yes. Construction for destruction, so it was okay. During COVID time, I got to know Mr. Rajkumar by a common ozone enthusiast. Mr. Rajkumar helped one of our clinical trial, which was on ozone saline during COVID time, by donating generous amount of 5 lakhs. He also used ozone saline extensively in his hospital at the Podnur, which is called GD Naidu Hospital. His hospital has innovative treatments like IV laser therapies, ozone saline, laser acupuncture, high-dose vitamin C, and many poor patients get treated at very low cost. I request Mr. Rajkumar to say a few words.
Good morning to everyone. Dear Karthikeyan, Mr. Ramesh Shavanji, Mr. Manikam, Dr. Lambato, and Dr. Milisha, thank you for giving me this opportunity to be here and say a few words. I'm not a doctor. I got into medicine because of my own health issue, which is loss of hearing on my left ear and acute tinnitus when I was in Germany. And that brought me into laser treatment, and laser led to ozone, and ozone led to IV laser treatment, and finally we also have now oxygenation and molecular hydrogen inhalation treatment in our clinic. So we're doing an integrative treatment along with allopathy, but integrative within the naturopathy. It's light, ozone, oxygen and molecular hydrogen. So this is given a lot of benefits to our patients, particularly poor patients. And today our clinic, because of COVID, unfortunately I have to say this, COVID was not easy on all of us. It was very difficult. We lost a lot of lives. Many people suffered. But through COVID, the finding what came out was indirectly, many of the COVID patients had benefits in, particularly patients who had diabetes, found a lot of improvement in the healing of the diabetic wounds when they came for COVID treatment. So that word of mouth spread all over the southern part of Tamil Nadu. And I have our pillar sitting here with me, and that's Mr. Arun. He was the one who believed when actually it started, I'll put it in a nutshell. My father had an aortic dissection. And after the aortic dissection, they had inserted a stent in his groin, for which they had made a big cut. And he used to come to do dressing for my father. And I used to give the laser light to him and tell him to hold the laser light on the wound. After about 1 week, he came and asked me, what is the magic behind this? The wound is healing very fast. And then I told him, it's because you're generating ATP to the mitochondria. And that's how he believed in it. He joined me, and today we could make a big difference to many people. And I'm sure all of you will also make a big difference. And if any one of you want to visit our clinic to see what we do, I think we do per day, I think 30 to 40 ozone baggings for diabetic foot. And we use laser on the wounds to heal. And two of our doctors are also here, Dr. Ramya and Dr. Vanishri. And we are able to do a lot of difference to people, and I'm sure every one of you can contribute. And as Mr. D.R. Karthikeyan said, heal the world with ozone and other natural remedies. Thank you one and all. Thank you for this opportunity.
I request Dr. Jignasha to come up and felicitate, along with Dr. Lamberto Ray, Mr. Rajkumar. Dr. Jignasha, felicitate. Dr. Lamberto Ray, who has visited us in 2019 conference, and he was kind enough to visit us again this year. Thank you, Doctor, for coming back to India. And I really thank you, because he was just not well for some few days ago, but the magic of ozone always works. And today he's here. Thank you. Dr. Ray is specialized in clinical pharmacology and toxicology, and is an expert on pharmacological experimental techniques like in vitro assays and in vivo experimental toxicology. Since 1991, he started his work in natural medicine and in holistic vision of medical treatment. He collaborated with World Health Organization in the Phase 4 drug surveillance program. He was invited by Dubai government in 2002 and has contributed to the development of Ozone Center in Rashid Hospital, Dubai. He was awarded by Riccardo Monti Prize with scientific work done to spread ozone therapy practice in Italy and around the world in Florence in May 2013. He is recognized as a chairman of Technical and Scientific Committee of World Federation of Ozone Therapy, and he was also a president of Italian Federation of Ozone Therapy. Today, till date, Dr. Lamberto has published more than 200 publications on ozone therapy and different medical aspects. Dr. Lamberto, I would love to have some inputs from you for ozone therapy.
Thank you, Olio, thank you, Mili, thank you, the chairman. I remember you the last time when I was here. India for me is a special people, special doctors. In Europe we have to fight a little bit more. This is the reason why I am here, and I am all over the world when they call me, because I want to explain exactly what ozone is. So I heard before the future will arrive. The future is now, but we are not ready so far. This is for the next generation. So the people must decide if that, because we don't have any medical treatment, or can try to survive. But to do this, we need to give them more information. It's not possible that one doctor in Italy or any other place tell to one patient, no, ozone, no. Be cautious, ozone could be dangerous. We can hear these words. So I would like to ask to this doctor, why not? No answer. It was not in my course in the medical faculty. So we must be able to explain why yes. And so far, there is to fight a little bit, but we are near the recognition because we have enough data. Those I am looking for are the data to explain why this miracle is so powerful in integration in a lot of areas: cancer, orthopedics, neurologists, immunologists, and so on. We have the key to understand this now. And I show in my lecture all the last news about this. The epigenetic mechanism induced by NRF2 that is modulated by small oxidative stress with ozone. Okay, thank you very much for inviting me. I'm really very happy to be here because you are very special.
Speaker. Thank you. To celebrate and appreciate doctors who have worked extensively in the field of ozone therapy. It is our token of love and recognition for their work. Friends, we have more than 15 doctors this time who are getting appreciated for this. So I request Dr. Jignasha to just, keep all my, respected doctors in, line. So the first is Dr. Sanjay Sachdeva from Delhi. He has been instrumental in promoting ozone therapy to many conferences, to many institutes across India. So sir, Mr. Manikam, Mr. Rajkumar, Lambertore and D.R. Karthikeyan. I request you all to be standing only. Okay? You've been punished. You can also, sir can also give. Thank you. Next we have Mrs. Alia Binsi Matthew, who's a clinical psychologist and also very enthusiastically practicing ozone therapy. है क्या? नहीं, okay, no, not there. Okay, next I want Dr. Ankita Delia to come here and take a memento for Shri Shri Tattva Panchakarma because they've been instrumental in training more than 60 doctors of their own institute and making ozone available in Shri Shri Tattva also. Dr. Ankita. Next we have Dr. Bhaskar Agrawal from Lucknow. He's hello. It's an exercise also. Huh? Yes. So Dr. Bhaskar Agrawal is a biodentist from Lucknow and has been very instrumental in doing many research in biodentistry from King George University, Lucknow. Next, we have Dr. Rakesh Jaiprakash from Bangalore. He's also been very instrumental in promoting ozone in Bangalore. Next, we have Dr. Neha Savla. Where is she? I can't see. Hello, come up. Dr. Neha Savla has been instrumental in doing ozone therapy for old age home. Complimentary, she visits their old age home and gives ozone. So we welcome her to be on the stage. Next we have, okay, Dr. Neha Savla. Now you go to Mr. Chauhan and he will give, okay? I'll now request Sir Ramesh Chauhan to give memento to Dr. Sunil Jadhav, who's been an Ayurveda and ozone practitioner for many years. These are all practicing in their small little places but creating major impact in promotion. Next we have Dr. Hina Syed from Neurogen Hospital, who's been instrumental in doing ozone in KLS Wellness and also working during COVID time. We have Dr. B. Venkateshwarlu, who has been also instrumental in promoting ozone in southern part of India. Okay, where's my Dr. Parul Parikh? My friend too. Dr. Parul has been instrumental in promoting ozone in Kandivali, Borivali. She visits hospitals and promotes ozone to various allopathic doctors and putting it a voice forward that yes, you should integrate ozone in conventional medicine. Next we have Dr. Rujuta Chhatrapati, cancer warrior, never left her zeal to work. Today she is also here. She started a wonderful center in Surat to make ozone proud. Come Dr. Rujuta. Okay, we don't have doctors. Rakho main bolti. We don't have doctors instrumental in promoting ozone in Jaipur city where there are practically no ozone doctor, only one or two. So Dr. Sarika, please continue your good work. Next we have Dr. Samir Dodia, who's shocked. Dr. Samir Dodia is instrumental in putting up a wonderful center in a small suburb of Mumbai, which is called Bhayandar, but having a wonderful practice and working extremely well in integrated space. We have Dr. Rajendra Mirji from southern part of India, and he's really helping promoting ozone with Ayurveda and ozone therapy. Yes, Dr. Rajendra Mirji, please be. Next we have So Dr. Geeta, please continue your good work. Okay, there is one person who's like a bubble of ozone. Dr. Samir Nayyar, please come on the stage and accept this appreciation token for being a wonderful biodentist and continuing the work in Punjab where ozone is there. Hawa nahi dete, ozone dete hai. Okay. So, and I also have Dr. Mihir Ranavne. Yeah, yes, Dr. Mihir is a biggest supporter of Ozone Forum of India. Every conference and every training program, he's the first one to register. He's the first one to register, and he's promoting Ozone across India and Dubai also. Thank you. Okay, so moving on, please don't just keep hold. Okay, yeah, my heart. We would like to felicitate our speakers with our token of appreciation. So I request Dr. Shrikant Sundaresh to come on the stage and accept his memento. Dr. Rajeshwari Bhuj, kindly be here. Dr. Vipul Kakkad, kindly be here. Dr. Sri Sudha Chipalia. She's there, Leroy? No. Okay. And of course Dr. Jignasha Captain, and the last but not least, Dr. Milisha. Come, Dr. Shrikant Sundaresh. Dr. Vipul Kakkad. Yeah. So, okay, there is a story of all these lectures being shifted to pre-conference. The pre-conference which we were going to do was only with OFI speakers like me, Jignasha and Shrikant. Okay, we got such a good response for this conference speakers, we had to shift few of our speakers to first day. Okay, so that's how these doctors have agreed not to speak, which is, so next we have Dr. Rajeshwari Bhuj. Do we have Dr. Sri Sudha here? No. Okay. Hello, Leroy, kidhar? Next we have Dr. Jignasha. Let's have a good round of applause.
So next we have the most important person who's behind Ozone Forum of India, Dr. Milisha.
Okay, just take photo. I request Dr. Leroy Rebello to come here and accept a small token. On 6th of February, he conducted exosome therapy training program at our bisleri clinic. So Dr. Leroy has been working in a regenerative medicine, and his famous brand Biotex has been giving lot of good results. So we welcome Dr. Leroy. So Dr. Leroy is giving lecture tomorrow, so his memento we will give tomorrow. Come, Dr. Leroy. So today, so just please have a seat. Today we are very pleased to announce that one of our very senior OFI member, who is also a pioneer in stem cell research, Dr. Alok Sharma, who was a major proponent of ozone therapy during COVID time along with Ozone Forum of India. Today, he has decided to launch his book on anti-aging and longevity integrated approach in this esteemed conference. I request Dr. Alok Sharma and his team to join us on the stage to launch this book. And I would also request Dr. Alok Sharma to speak about his book. Welcome, sir. And sir, once we met in the conference and learned that ozone can do wonders, and he immediately took it off. And I think together we have created a good Sharma. So you should be here. Sir, where is it? Stand. We all can stand up to stand. Dr. Himangi. Here she is. You can come here. Is that okay? Music event.
Respected Chairman Chauhan sir, respected Shri Karthikeyan, the former Director of CBI, and all the respected dignitaries on the stage. Thank you all for participating in the release of this book. The title of the book is Science of Healthy Living and Longevity, Practical Tips on Wellness and Anti-Aging. Now, I want to let you know that the base of this book is from our ancient Indian traditions, embedded in yoga, embedded in Ayurveda, and embedded in natural therapy and naturopathy are all the secrets and science to anti-aging and wellness. Now, anti-aging is not just living longer, but it is the years that you live to add quality to life. So how do they define anti-aging as to die young as late as possible. To die young as late as possible, So to remain young. And it's been my pleasure and privilege to have seen Chairman Chauhan have, looked after him, and he's been also very motivational, inspiring person, living life to the fullest. Another person who's been very inspiring, and I talk about him in our lecture, is Honorable Prime Minister Sri Narendra Modi ji. He follows all the principles that the world is today talking about in science and anti-aging. He actually lives all of these. From yoga and exercise and healthy living, all of those things are practiced by him. However, in modern living, it is not sometimes possible to strictly follow those principles. So today, we have technology like ozone therapy, hyperbaric oxygen therapy that uses nature. There's using the 4 elements of nature, earth, wind, rain, fire, together to heal the body. So anti-aging is about using the ancient Indian Eastern thinking of thought processes of healing, but using modern technology to deliver it. For example, we all know, just a simple thing, in the wild, in nature, sir, animals don't get cancer. But when you make them our pets, they get all our cancers. The reason being, in nature, there is abundance of oxygen and less animals breathing. In our society, we have more people breathing and less oxygen, and the oxygen is polluted. You know what is happening to the quality of our air. So that is, now since we can't give good oxygen, we are using technology like hyperbaric oxygen and ozone therapy to deliver this. The principle of yoga is basically based on pranayama. What is pranayama? Pranayama is deep breathing so that your body gets oxygenated better. So that is all we talk about here. Simple principles using modern technology to deliver treatments that have been defined already. Thank you for releasing this book. There are some very simple tips over here. Things that you can do at home. Things that science is today showing can help. Thank you so much. Thank you, Dr. Mili.
Has been kind enough to give a complimentary copy to everyone, all of you who are present here. So I request that team to hand over the books to all our participants. Dr. Alok, just join the podium. Okay? Okay. So just hand over the small book. Moving on to an interesting segment by Mrs. Krisha Ambani on discovering our duty on healing humanity. I request all my esteemed guests to be seated. Krisha, who's a creative strategist, system thinker, community builder, writer, her current professional interests are centered around driving social change by enabling interdisciplinary dialogue and intentional collaboration. Krisha has many initiatives like Love Not Fear Mankind, Gyan Ganj, New Horizons, New Earth Foundation and Local Futures. I request Krisha to come up on the stage and take this dialogue of what is our duty to heal mankind. Of course, the questions will be asked to the people who are present on the stage. Over to you, Krisha.
Thank you to Dr. Mili and thank you to Mr. Chauhan and the entire OFI team and family. I don't come from a medical background and I wasn't really interested in healthcare until the last 5 years took shape. Many of our guests here spoke about the darkness and the despair, the grief that many of us experienced during the COVID period. It was that darkness that got me to question what is the meaning of duty, what is the meaning of service, and what is the meaning of truth. Why is it so difficult for us to develop the capacity to engage in honest and courageous dialogue? I mentioned this at the last OFI conference, but I will mention it again, that of course, I'll continue. Realized that appropriate treatment options weren't available to people, not to the general public, not to our friends and family, not to patients and not to doctors either. The awareness of what kind of integrated health treatments can be offered. I lost my father to this challenge, and it caused me deep sadness and immense grief to know that treatment options were available, but we just couldn't avail of them. That was the catalyst to encourage me to seek out individuals, both in India and around the world, to find out who are the people who know their duty, who understand their service to humanity, and who are ready to speak truth to power. Dr. Millie came into my life at that time, and that opened the doors to question and to learn about integrated and holistic health, including ozone. I'm inspired by the enlightened leadership that's present on the stage today that goes beyond just doctors and people in the medical profession. It's people who come from public service, people who come from government, people who come from business and industry. And that's a conversation that I want to take back home to my family, to my friends' families, because many of us here in Bombay come from business and industry families. And I believe there's a very powerful role that we can play if we know how to come together. And I'm looking forward to getting more insights from some of the industrialists here on this stage. So my questions will include some of those themes, and I would like to begin with Dr. Karthikeyan. I would really like to ask you, sir,
hello.
The last few years I kept wondering and questioning why people who are in positions of power and responsibility, who have taken up the position to serve the public, to serve citizens of the country, where their sense of duty seems to have been lost. As someone who is truly inspiring, and you have carried on the pillar of understanding service, dharma, duty, can I ask you, how do we rekindle that flame amongst others who are in these positions, and what might be the challenges that they need to overcome in order to discover their sense of duty?
Yes, it's true what's happening is unfortunate. It's all because the lack of values. People want power, money, fame, any means available to them. So we have to start with the family first. The values have to come from the family, and then the school. Unfortunately, the spiritual values, the right attitudes and all that, like being right, kind, compassionate, caring for each other, all this has to come from this family. It is true with this modern lifestyle coming, people are becoming more and more selfish. Then people, the parents do a lot of sacrifice and bring up the children. But you see, unfortunately, what's happening is, once they grow up, the thing is lack of affection and gratitude. One is affection because you have been brought up by your parents. Then gratitude because all that they have done is to bring you to whatever. So we have to start bringing back to in basic education, ethics, moral values, caring for each other and all that. Ultimately, we realize, we have seen money, material, prosperity, power, all these things are all right, but not for the purpose. You've seen, unless, you know, the purpose of life should be ultimately take care of yourself, your family, the society. And what you do to others who are less fortunate, from whom you don't expect anything, but as a compassion, do it. Only those people you see, they have contentment and life. Real prosperity, contentment, joy is when you do it for the world, for the environment and all that. That is real people realize. That's why you see multi-millionaires all over the planet. After earning money, they give away to charity. Somebody asked, like BBC asked Warren Buffett, you are the richest man in the world. Why are you earning more and more? He said, I enjoy giving money, but that is for, much more joy I get in giving it away to deserving causes. But to get that satisfaction, they asked Mother Teresa, you're a frail old lady walking the streets of Calcutta. How many people can you save? How many abandoned children you can give? How many people? She said, the problem is so big. She said, doesn't matter. I can't do everything. That doesn't mean I should do nothing. I will do whatever little. That's why I appeal to all of them in management schools when I go and tell them, you are fortunate to get into a MBA. You got not a degree, a job on hand. Now, whether you go to any place of worship or not, it's not. Take one decision. I will do something to one person less fortunate than me. I said, that is the purpose of life now. If 50% of the population in the country now, at least, they are above poverty line. Not more than 50% are below poverty line. Each one above poverty line can take care of 1% less than poverty line. There is no poverty in the country. Compassion, kindness, the world is without power because there is no value attached. Whether it's Ukraine or Australia, you see that now. That is why we are called project meditation. I say everyone should be taught meditation. Even 8-year-old, 9-year-old child can. Yes, Mahatma Gandhi said, no, Dalai Lama said, if every 8-year-old child is taught to meditate, there will be a world without war within one generation. Then when you meditate, you know what is right. Your conscience will tell you. Then you become good, kind, compassionate, care for others, care for the environment. Like that, everybody doing it. Families will be happy, harmonious. You can create leaders. Leaders now, even the good of leaders, they want wait election for 5 years. After 5 years, how to continue to be in power. Not a long-term term. So if everybody is meditating, you will elect ethical leaders. Ethical leaders become controlling the government. The nations will be ruled by good people. And when the nations have peace, harmony and care for each other, then only those nations can create a world without war, a world where there is compassion, caring for each other and all that. That is why we are promoting meditation, project meditation, the whole world. Till then, we will continue to see this injustice and exploitation. Thank you. Namaskar.
Thank you, sir. Yes, amongst younger people, students and many others have been speaking to a desire to incorporate ethics as a core part of educational curriculum is certainly there, and I hope we can see more of that with your leadership. Mr. Manikam and Mr. Rajkumar, I'm very eager to know more from you about how we can motivate and inspire other industry leaders to not just promote solutions like ozone and integrated medicine, but solutions that are good for environmental health, planetary health, and human health. The challenge I faced in raising this conversation with many is there's no money in it. Where will the money come from? Who's going to pay for it? Go to government. We just talked about the problem that lies when you try to go only to government. So I ask you as a student and as a very eager aspirant of wanting to get more business and industry leaders to join forces and join hands to contribute towards solutions for environmental and planetary health. However, not just looking at complex technological solutions which are driven more by the ego, but rather maybe low-cost technological and mechanical solutions that can have wide impact. I'd love to hear both of your comments on the same.
Thank you, Krishna. Actually, my first question is, why do you need money? Because what is life is what you need to enjoy. Right? I want to live my life as I think it's going to be fit. I should enjoy, I shouldn't be worried. And what you see normally is children enjoy a lot, they don't really look at money. Okay, so we are using money as a replacer of success, but what real success is, what you need to do, you need to be curious, you need to be looking at our journey. For instance, both of us are not doctors, but we felt the doctors didn't know what they were doing. Okay, so do I take my child to someone who I think doesn't know what he's talking about? Okay, so when you go with the disease, I go to a doctor, I ask him a question, you don't look at it, it's my problem, I'm going to give you the solution, you take it. That's something which we don't accept in industry. We try to see what I can solve, how I can do it. I ask for explanation. If I buy equipment, I ask if this equipment will work. Okay, we ask for the details. But when I go to a doctor, if I ask for details, I'm asked to shut up. Right? Because the doctor says, this is what I have read. And if I go to 3 doctors, I get 3 different solutions. Yes. Depending upon whether I'm going to naturopath or allopathy or whatever. So that is where we decide to step in, saying that, okay, we're going to start looking at it, we're going to ask the questions, we're going to find solutions. And that's where you take the next step. So you actually transcend not being a doctor, walking into the doctor's realm, asking him, why are you doing this? Why not do this? So this is where you start pushing it. It makes you very unpopular. My local doctors hate me. They think I am crazy. Right? And in fact, my family doctor called me and said, don't you have anything better to do? Right? I mean, your father was such a great person and you are spoiling his name by going into something which you're not supposed to do. So I said, thank you very much, but I still am going because I want to look at what I'm delivering to my family. Right? So you need to walk a little further. You need to ask some questions which people may not know the answer, so they don't tell you. So this is where the curiosity will take you, the childlike curiosity. At the same time, don't be very egoistic. Don't try to tell the doctors they don't know what they're doing, because they know what they're saying, but that may not fit to the particular situation. And that's why we actually transcend. If you look at our clinic, we are treating cancer, and we don't really take any one discipline. As Dr. Pradeep was explaining, I have 5 disciplines sitting together. They may not quite agree, but we try to find a common path which will be the least damaging to the patient. So it's actually going back to your own school days. You're going back to your childhood, being curious, being not afraid of asking questions, and being humble enough to keep moving, looking for a better solution. So that's what it needs, and that keeps you excited. So you're looking for a better tomorrow, you're looking for a better solution. For instance, let's talk about municipal sewage. I'm just talking about the environment. Now we have a great institution called NEERI in India. Okay, this is National Institute of Environmental Engineering based in Nagpur. They have devised a solution which can take care of all municipal waste based on plants. But they have not been taken by any government agency to be implemented. This is a government body, it's a fantastic solution, but we are not using it. In fact, we are implementing that in our college for about 200,000 liters a day. And I was surprised that's going to be the largest plant in India. So, but they've got pilot plants, it's brilliant. It's a very simple solution. It is Indian grown. But we are looking to Europe, we are looking to America, we are looking to somebody else to give a solution where our own people have a solution. So this is something, again, you need to step across. So I think I'll let Mr. Rajkumar take it further.
To your question, it's a little difficult for me to answer regarding why one gets into helping others and treating others, and the money part of it. where does money come into the picture? So here, I would, as Mr. Manikam said, why do you need money? Yes, you do need it maybe for certain luxuries and for existence. But if you look at it at the end of the day, when, I've seen my children being brought out of the ward immediately after birth, their fists are closed. It doesn't come open. So when you leave the world, what do you take with you? It's just a journey you had between birth to leaving the world. And you came with nothing and you're going with nothing. You're literally sent into a crematorium with nothing on you. So in this journey, what is one contributing? Each one has a different fate. Some have luxuries, some have power, some have money, based on where they are born, based on the legacy. And at the end of the day, if you are given that opportunity to contribute, because you come from a family where you can contribute something, I think one should do it. Some may have knowledge. Knowledge is also wealth. And the doctors who are here, present here, many of them, what they have is the opportunity they had to go learn to be a doctor. And what they have is to become a doctor and gain all that knowledge. And what they can contribute is to make humanity better, with better healing, affordable healing, and with a holistic approach. And that is what Mr. Manikam was talking about 5 different treatments they do to give affordable healing. And that's the same thing what we are also doing. As far as I am concerned, personally, you know, we both shared with each other, and many of them do not know here. Our roots, Rishad and myself, we went to the same doctor. We just realized it a couple of hours back. Being a German doctor, she went to him in Ibiza because he was literally thrown out of Germany for doing laser treatment. And I got interested in medicine because of this laser treatment for a year. And I went to the same doctor. And she also went to the same doctor because of the same problem. And we realized just a couple of hours back that it was the same doctor who treated us. So that is what ignited me to look into healthcare, from ozone to, from laser to ozone, ozone to oxygen, oxygen to molecular hydrogen. So within naturopathy there are so many things also. And I think if all of us here integrate it and use it properly, we can make a big difference. And I'm not saying there are many doctors who are in our side of the field of ozone and naturopathy. There are a few doctors who rubbish allopathy. I wouldn't say allopathy is, is of no use. If used the right way, you need to combine quick fix solutions. You need allopathy. You can't just rubbish it off. But the chronic problems, the chronic diseases, that is where the naturopathy, the diet, the gut-brain connection, all this comes in for the chronic problems. So, and coming to the chronic problems, you spoke about environment. We'll end it there for my part of the thing. The kind of the pesticides which are being put on the vegetables is a big problem on our health. Many of them don't even realize it. And many of you are doctors here. Just buy a ozone detoxifier. If people are eating non-veg, just put a piece of fish or chicken into a bowl of water and ozonate that water for a few minutes before you cook. Or strawberries, or vegetables. You will find a lot of froth coming out. And you will sometimes feel antibiotic smell coming out. That is the kind of toxins which are there. So we need to, in the agricultural front, we need to change the way we protect the growth, the farm produce, not by using pesticides, by other means. So these are the things which we need to look into for a better living and better health. Thank you.
So, do you want to...
I was going to add a little bit.
You have a question for me?
Yes, but you can continue with the same question as well.
Yes.
I'll build on that. As just last year we had Dr. Zach Bush, who's sitting here with us today. We had Dr. Zach come to our family hospital, KDH, and give a wonderful talk about the impact of glyphosate on produce and to educate doctors about GMOs and what is causing a lot of the chronic health conditions that we're seeing. I think this kind of dialogue that integrates the problems that we're facing in farming and in the environment and helping doctors understand the cause of a lot of the issues that they're facing is really meaningful, and we hope to see more of that. We've been leveraging international friendships and partnerships to bring in people so we can engage in knowledge sharing. We can share data, we can share information, we can share case studies. I'd like to ask you, Dr. Lamberto, can you talk to us also about the role of this kind of international cooperation, friendship, collaboration and dialogue? What is the role that that can play in helping us build a resilient, integrated health system that isn't just for one country, but for the world at large?
Thank you, thank you. This is a very important task, the intercorrelation between. In the last years, I visited almost 7 countries, Brazil, United States, so I can see the same situation. So this is the reason why, because there is a lack of attention by other medical doctors sometimes. I suppose that there are 2 kinds of people. One people that put the money before the person, and another people that put the person before the money. That is fantastic. And you must, these medical doctors or these scientists or these people that make the person, like this person is one of your family, your father, my son, my mother. In this case, I look for more knowledge. Because in my speech, I will talk about knowledge and quality. To explain to other doctors, give a look. Yes, you don't take other to do today. No, I'm interested in ozone. If you want, I can explain. And this is very important. So the problem is all over the world. So we have 2 kinds of situation, and ozone as an holistic approach. Because if you put the person before the money, when this person come in your clinic, go over the door, he became of our family, is in my family. So I need to talk with him before any kind of treatment. Just this move, a lot of mediators, neuromediators in our, and this holistic approach is wonderful. And so you can also be interested to understand how ozone works. Because ozone is the breath of God. So ozone was discovered in the late 1800, so two centuries ago, more or less, in Germany, the molecule of ozone. But most of the people, the ancient people, knows very well this. In the religion, they told, go in the morning to pray when the sun rises, because in that situation, the prayer will save your soul, and one gas will save your body. I heard this in Dubai when they invited me there, and I asked also to some people near the Pope. So all the religion have this kind of system. And you know, when in nature the ozone it forms 2 ways: during the storm and during the sunrise of the sun. In the morning, when from the trees oxygen go out, and this UV transform oxygen in a small amount of water, and you can breathe safely. So, some people say that for the future you need to give a look also to our past. And the clinical evidence is absolutely now necessary to understand why. And now we have this kind of situation. But last but not least is the first consideration that I did. You must love before the person and after the money. Just if you want to reach the best results for all the people. This is the question.
Yes, the last question, which is both for you and Dr. Millie as well. It's about bringing knowledge and wisdom into existing systems and existing institutions. You've done a lot of incredible things, Dr. Alok, and I would love to know from you words of advice and inspiration on whether or not or how to go about bringing deeper knowledge and wisdom and a sense of curiosity and experimentation into existing systems, be they academic or medical or government or any sort. How would you guide us to do that?
Okay. So this is something which comes from within. And for me, it started on the first day when I entered medical college, which was 1979. And my father accompanied me to leave me the first day. And on entering, he gave me one piece of advice. He said, son, when you go there, you're going to have people's lives in your hands. He said, whenever you have a patient in front of you, you imagine that is your family. And do for the patient what you would do if that was your family, right? Now, so I didn't understand. I said I was 18 years old, so excited about medical college. So I asked him to explain. He said, then your intention will never be wrong. You will not do something for money, fame or success, because for your family, what do? Only the best, right? So, he said, niyat kabhi galat nahi hogi. You will always do the right thing. Now for me, I'm entering medical college, so this is something I believed in then, I believe in now, alright? But this led me onto a very different journey, because when I started, when I became a doctor, I realized the limitations of modern medicine. I'm an allopathic doctor, I did MBBS, I did an MS in general surgery, an MCH in neurosurgery, and I was very fortunate. I had professors who told me, question the written word, don't believe what is there in textbooks. And so my whole life, right from when I graduated, became about treating those conditions for which there were no other treatments. I didn't follow the conventional beaten path. I said, let me look at something for which there is no treatment and then to find solutions for it. So it all comes from within, because it's your family, what would you do? Apart from doing the best, you would study the science, you go behind what is happening, you'll find solutions from across the world, you will do everything. So when it comes to knowledge, I believe that is where it should come from, because then you go the extra mile. You do what you would not have done if you're just doing it as part of a practice or for money, fame or success. It's also just to let you know that I learned, so that is from my father, right? I've learned a lot from my daughter, a simple thing, for example, I had a habit of, when on Diwali, if there's security guards, I would take a bundle of money, and give it to all of them. And she told me, no, find out how many people there are, put it in individual envelopes and then give it. Let them feel the importance of it. We have a tradition in our family that everything that we use, or clothes, we normally give it to an orphanage. And I remember once seeing her, we normally just give the clothes. What she would do is take each cloth, get it laundered, ironed and packed, you know. And I said, why are you doing this? You're just giving it away. He said, the person who receives it should feel the same joy as, you know, when I received it. So I've learned from two generations. I've learned to do everything that you can do. And also when you do, okay, it shouldn't be I am giving, I am treating, you know. Let the other person feel the joy of receiving. The joy of receiving is something else. And over the years, you know, I realized that the joy of giving, the joy of making a difference is much more than anything that you receive. You know, of course, you feel good when you receive, commercial remuneration, when you get awards and recognition. But the smile of, so we treat a lot of children with autism. And kids with autism can't speak, they can't go to schools, you know, they have behavioral issues. And you know, a child who can't speak, you treat them, and 6 months, 1 year later, the child comes back talking. That is priceless. You know, the tears in a mother's eyes when she comes and tells you, do you know what, my child could not talk, but the first words he said was, I love you, mommy. I mean, can you imagine that? It's raw emotion, it touches you, it energizes you, it makes you want to do more and different. And like Dr. just said, putting people before money is more important than putting money before people. So I've learned this from 2 generations, you know. And when you do that, then everything else happens spontaneously. It happens naturally. There is no struggle, okay? And you do what is best. And when you do what is best for the person in front of you, everything else comes as a happy side. The money, the fame, the success, the awards, they just come naturally. I call it a happy side benefit of the work that we do.
Everybody has said everything, but what I believe that the world of integrated medicine is a rocky path. If you expect appreciation and acceptance, don't do it. Just keep working. If you keep working, somewhere down the line, it will be appreciated, it will be accepted, and today we are all here. So it's not that how much you are working is, you know, don't expect that the patient will come and tell you. Just keep doing and the world will change. I think doing is everything. And integrated world also talks about self-care. Okay, if you are good and if you're working well for yourself and for your family, I think you will give the same thing to your patients and to people who come in contact with you. I think these are the 2 things which I would like to say. Okay, so no, don't go anywhere. So that was wonderful. Of course, we are delayed, but we are very much here for sharing the knowledge. And this segment, okay, this morning, Krisha calls, ये थोड़ा हटके है, it is not gelling. I said, no. We are here to celebrate healing. And the healing, when we give others, we should also understand what others who are industry leaders thinking. So good, thank you for doing this. And I tell everyone to felicitate Krisha for doing this wonderful session. And I also invite Mr. Anmol Ambani to be here on the stage. Yes. So wait, just Anmol is also. And Anmol has been supporting Ozone Forum of India and this conference since many. We need more and more industry people supporting the cause of integrated medicine, and the future is also only going to be bright. Don't accept it, just visualize it. Okay? I think visualization is the only key to get this happen. Thank you, Krisha. Thank you, Anmol, for being here. And also Krisha has invited speakers, different speakers from across the world. Unfortunately, I really can't give that much time sparing. Dr. Sunil Jain, welcome. And Dr. Reena Jain, welcome. Dr. Amitabh Banerjee, who's also a big researcher and an epidemiologist from, many of you know him if you are in integrated medicine. Thank you, sir, for coming. And Professor Bhaskaran, thank you for being here and understanding. So these are actually not from Ozone Forum of India or knowing ozone therapy to that extent, but they showed a keen interest towards ozone molecule which is unknown to them. Okay, thank you very much. I think we end our morning section. Alia is here now, so just accept this memento from Dr. Lemberto Ray. Just kindly come up on the stage. She was to be appreciated, was not present. Where were you? Okay. So, we are taking a lunch break. Okay, the lunch is served on 3rd floor. We will be back at 3 o'clock sharp here. We will be starting with Dr. Alok or Dr. Lemberto, whoever is. Because 3 o'clock, sir, we will start.
Little louder, sir. Yes. Volume, please. Hold on. There is no beat. Yes. I can hear it. Little louder. Quick. Done? Yes. Come on. Hit the beat first. Hit the beat. Everybody. Very good. More louder. I need a clap to overcome the music. Yes. Very good. Thank you so much. Thank you so much. I guess now people are feeling more active. Give a louder clapping one more time for yourself. Now it's a humble request to Dr. Lemberto Ray to please deliver your keynote up on the stage. A big hand for Dr. Lemberto Ray. Everybody. Thank you.
This fantastic field, this matter. I want to thank again Dr. Meli, 22 years in India. He is huge time, also president and chairman. All the people here are really fantastic. And it is for me an honor to share with you some news on how help suffering people that sometimes they do not have chance with this fantastic gas. And I show you now the last knowledge, because we had to spread this to all the people. So, okay, we can go with my presentation. And also thanks to the organization, because it's fantastic. Every lecture, the high quality of the lecture, because I heard this morning several lectures really, all the lecture was fantastic in different fields, several fields, in oncology, in orthopedics, with some new treatment that integrate really. The fact that ozone so far is not so accepted is because at the beginning we start to propose as therapy for all a lot of ailments. Instead of that, we can cooperate, we can integrate to reach the best results. So this was my history, and some people told me at that time, but you are crazy, doctor. because after 40 years studying pharmacology, so pharmacology does mean drugs, medicine. So adrenaline, acetylcholine, beta blockers, and so on. So my mind was built up since the beginning. I was very young. When I was in the university for the first time, they told me, doctor, you need to start, because at that time I studied engineering, you can imagine. In the Faculty of Medicine, they told me, no, you stop that, study medicine, and start to do this kind of work. Because I was immediately in loss. So something that God sent to you, and this is for you. And I start to work doing research, scientific research, in the field of receptors, acetylcholine receptors, and neuromediators, with Max Planck Institute, very high level. So I know what is science, but I know that there is good, poor, and rich science, but it's the same. Because if at the end of my history, so neurophysiology, pharmacology, after 40 years of university, before resigning, I started to work with Ozone. I resigned university in 2010. So about 15, but till 2010, 40, I was inside the university. But I was thinking, what are we doing if we give a stimulation of one receptor? Okay, we can increase the heart rate. Or we give the beta blockers, and they can reduce the heart rate. But this could be useful for a chronic treatment. So I started to think that probably there was something wrong, and the best solution would be try to know why the heart rate changed, or why another cell does not work properly with the DNA. So every cell in our body, neuron, skin, liver, muscle, are the same machine. The same machine with the same DNA, but some gene has been repressed because we don't need. Other gene make this cell specialized to do some things. The liver to clean, the neuron to think, to do synapses, the muscle to contract, the heart. So the machine, the single machine is the same. So perhaps if there is a mistake in one cell, we can have the problem. And what we are doing by pharmacology, what we suggest to our doctors, you need to give something to fix from outside. So in those 40 years I saw a lot of bad things. So my person must be killed. You can change my opinion, perhaps I'm wrong. But you need to demonstrate that I am wrong. I can use this kind of treatment with receptors. It's very rapid, very quick, like the people want. The people want to feel good. They don't know that if you feel good soon, you soon could come back. So my idea was, why we don't look the reason why this cell became sick. Could be the oxidative stress, we don't know. Could be some genetic movement activity. Some gene that express more, some gene that express less, some gene that age. So in Parkinson, really you're doing beautiful things. So these neurons or substantia nigra that for all your life start to produce dopamine, walk. And his age became old, 75, 85 years. So it works less. And if there is some familiar problem, or something where you live or your lifestyle is not good, can increase. So the age and reduce the function. So start the extrapyramidal movement. What I suggest to doctors following pharmacological field, no problem. Take this dopamine and give this to it. So if I was the same neurons, age, that work not so fast, and I can see that you give me from outside this performance, I stop to work at all. And this is not just Lamberto words. In physiology, we name down regulation. Down regulation that means that one cell dies if there is no function to do. Okay, this is the preface. This is the preface. You can go on. And because it's the preface. And I had an input at the end of my career. I was in Cuba, and the other doctors, I never heard about ozone since 1995. 1995, nobody, I didn't know nothing about ozone, just told me the bad things that you can see on the web. So on the web you can see toxicity of ozone, or the ozone hole. So all the bad things about this gas, nothing. But Olga Sonia Leon told me, Lamberto, why you don't try to study ozone? What is ozone? So I before anticipated my way of thinking, my mind. My mind wants to look the best for my son, the best for my wife, the best, not only for my family. All you are my family. All you. So you want the best and the safest, like we have in our role. So when she told me, she told me the first time, she told me, if you give Lamberto, you are studying, because at that time in my protocol of neurophysiology, I studied nicotinic receptors, and she told me, why you don't study a small amount of ozone to see if there is some interaction? Okay. And the idea was good. So if I give a small oxidative stress that could be the same that promote an illness, may I have back a response, a positive. But at that time, we knew nothing about what I show you later. Nothing. So it was only an idea, but a good idea, that fit very well with what was my intention for people. Try to look for the problem, not to solve the problem. Okay, Olga, this could be. But coming back to Italy, you can imagine how very strange. Sometimes it's very strange. So you can also understand why I am so passionate. Because another professor, one professor of pharmacology of the University of Catania, the name was, he's passed away, Umberto Scapagnini, that in the future he will become the medical doctor of the President Berlusconi, you remember, no? You can imagine this. Umberto Scapagnini at that time was only a professor of pharmacology. And one day, just in the same period in which I met Olga Sonia, so was something strange, of course. He told me, Dr. Lamberto, just talking about other things, he told me, you never heard about ozone? No. try to give a look, because there are some doctors using ozone in Bergamo, in Italy. Okay. So I received one input, and this is the second input, just in 1-2 months. So I started really to be not convinced. Nobody can convince me, only my mind. If the topic looks correct, not with conflict of interest, because there was no conflict of interest, just only helping suffering people, in which conventional, can you go on please? To help conventional people, to help suffering people, to use some methods that could be not aggressive, but can be better in the topic. And just we come back to what we said this morning about the doctors. Usually, it's very easy also now. There are a lot of news, a lot of clinical cases positive about ozone. There are some doctors, and the patient come to me and tell me, my family doctor told me that it's just a joke. And I ask, please tell doctor to call me, because I can understand him partially, because in the course of pharmacology or to become a medical doctor, there are nothing about ozone. So he can understand only the action of medicine, or drugs or receptors. That is the Michaelis-Menten, that is one pill, one effect, 2 pills, 2 effects till the maximal effect. Rapid effect, because the receptors immediately when you see the drugs open and activate the function. This is the only model that you can find described in the medical fact. So this was another thing, and this is the reason why also many errors we did, because there was a division. I want to say that when we find something good, please, we have to take care about this. To take care, don't try to do some mistakes. Take care and start from the beginning. I start with Professor Bocci to say, please, could explain me, because I have no idea. But oxidative stress, second messenger can activate at mitochondrial level, the antioxidant response, and so we have some papers. Go on, please. But only some poor knowledge about the possibility really to have effects on the body. But if you give a look to this, it's like this morning, our destiny is to die. So these people, amyotrophic local sclerosis, we have 2024 papers, no chance. In Parkinson's disease, dementia. So I am talking about this just only, but a lot of problems are without solution. Or we have the solution, and with the solution also the side effects, that sometimes is worse in respect to the. So this reason is important. It's very important, this evidence, this information, to force us to understand better how ozone can be so helpful. Go on. Also because we know this. So we talked this morning, we spoke about the money and the person. All of you know that ozone started to be used at the beginning of the past century. And if you give a look, the stop of its uses from 1935 and 1960 60 was when Food and Drug Administration was created. Because Food and Drug Administration created one group. They have this idea, and all the medical doctors, they can't use nothing outside medicine that can be checked by science, the rich science. So I agree that we need, this is the reason why I want to know how ozone works, but it's very difficult to do some experimental protocol. Also because you don't have people that give you money to do this. For medicine, the only reason is this one. So, okay, I remember when I was at the beginning of my career, they sent me just one substance. Hi doctor, this substance is like adrenaline. Could you test it in receptor, in adrenergic receptors? Yes. Give me. I give it 10, then experiments. Obviously, all the people, because if I give adrenaline to all you or one substance that's similar, all you increase the heart rate. So fantastic. We have a significant statistic. This you can publish on neuroscience or in immunopharmacology, and you can become a professor. For what? For me or for suffering people? But if I try to do one protocol to demonstrate, for example, the effect of the ozone on Parkinson's disease, just last year I had one QIP person coming to me, and he went in the clinic for many years, and he died 99. And I told him, if you give me, and he was probably lost back pain, that was perfect man. Some problem of Parkinson, not diagnosing, so without taking any medicine. And I told him, if you give me $1 million, I demonstrate 100%. Because you need money in this case. Also because we need to convince neurologists to cooperate with you. And who gives to me this kind of this amount of money? Nobody. In the medical field, for medicine, to develop a new drug, you can use money because after you can sell in the pharmacy and you can have back the money. Very simple. So I am not criticizing the science. The science is important. But if I am curious to know how ozone works, or you give me the possibility to do this, because ozone never will be sold in the pharmacy. You can't go in the pharmacy asking 1 kilo of ozone also. Okay, go on. And now, so after about 30 years, 32 years, in 2018, I read one article on a journal with an impact factor of about 19. General pharmacology, we can see later. So very high impact factor. They never cited the molecule of ozone or oxidative stress. But they talk about one mechanism inside the mitochondria, inside all the cells, that could be that is one sensor that checks for the oxidative stress. So I was really impressed because this could be something that is joined very good with ozone, with medical, with the potential of ozone. So 2018, we started ozone about 30 years ago, 22 years. So you can imagine, we work with passion, with seeing the people feel better, because in the clinic we have people that feel good. The unique case that we have together is the molecule, ozone. Because in any place, I go all around the world, Uruguay, Argentina, Brazil, United States, China. I am sure that most of them use different protocols and perhaps also different machine to produce ozone. That is the main key, what you inject in the body. But all the people treated with ozone felt better. Millions of persons, millions. So since a few years ago, we had only hope to know better what body says, okay? Oxidative stress with a small amount of ozone, lipid peroxidation, second messenger, and activation of defenses. But now, we have this that most of you know very well. I call this the second sensor that demonstrates on how our body is the perfect machine for healing itself. It is mandatory that we don't go over, so we don't block this, because if we give medicine sometimes. But if you remember, in 2019, the Nobel Prize for Medicine was given to 3 doctors, Semenza, Radcliffe, and another name I don't remember, 2 Americans, one British. They discovered the mechanism for which one cell, the first sensor, is sensitive to the level of oxygen. HIF. This is a protein that is inside our cells. It's a biochemical pathway, HIF, that if everything is okay, so the oxygen supply in the cells is perfect, no problem. But if the oxygen go down, hypoxic situation, this HIF go to the nucleus, to the DNA, and start the activation, the upregulation of one protein that is an erythropoietin endogenous of our body that help our body to breathe the same oxygen. Nobel Prize for Medicine, 2019. So, perhaps my experience as a researcher make me more attracted by some news. But this was really fantastic. So this is a machine. God, this machine is perfect. When you're born, no, it's not perfect. It's deliberately imperfect. Because we need to die. Otherwise, because they give to us everything I don't know. So, we're born and we know that on this planet we need to breathe oxygen. And we breathe oxygen since the beginning of our life till the end of our life. And oxygen is the engine, is the gasoline for the mitochondria to produce ATP. So we move, we think, we dance, and we age. Because this person in our machine put also some defenses. Otherwise you're born and you die. You need to die in quality, not in quantity. So we have everything. We have antioxidant enzymes. inside our cells. So, that is important to understand if there is this sensor that can be activated also by ozone. But the Nobel Prize on the sensor that check the oxygen, that our body itself is able to fix. And the second sensor, this one, it is much more important. Because this check how ozone, how oxygen burn. So how oxygen burn significant how oxidative means how much oxidative stress you can generate and you can't counteract. And this NRF2, like HIF, for the level of oxygen, move if we give a small oxidative stress or during the stress every day. So some doctors suggest to my patient, please be quiet, be cautious with the ozone. Don't go there for a long time. These are stupid things, no? It's like, because ozone is like oxidative stress that they are moving. That could be more or less. This is the eustress. The eustress is important to live on this planet. So a moderate stress can give you this. Because through this pathway, it controls an area that is antioxidant response elements, where there are genes, area that can fix the problem of all the aging processes that could be not correct. Cardiovascular, neurological, oncological, and so on. But we will see that. We will see. So at that time also, there was no papers regarding the possibility that ozone could be able to activate this pathway. Now, if you give I show you later, I don't know here, but there are a lot of studies regarding NRF2. But only few considering ozone, medical ozone. Because this pathway can be activated by other substances like curcumina, bardoxolone. And the paper of this Quadrado that I show you later, they are using this medicine, so a receptorial method, not a stimulating method like ozone. This is the reason why they were cited. This is what we have in our cells. Normally NRF2 is blocked by KIP1, like HIF, and is destroyed, but when we need this protein, you can see this. What is the difference between the papers published by Quadrado in the Journal of Pharmacology, 1919 impact factor, and the papers that we publish on lower level? During COVID, I want to show you this. I don't have here the slides, but during COVID, I read one, before I tried to publish my paper, could be possible that also through NRF2 could be helpful in COVID? And we all know that, sure, because we know that increase the delivery of oxygen to tissues. That is important. This morning I heard for the first time, it is wrong to tell increase the oxygenation of body. No, increase the release of oxygen to the tissues. That is important. So there is a modulating effect on cytokines, reduce the pro-inflammatory and increase the anti-inflammatory. But the only possibility that we demonstrate was medical ozone with the eustress and pharmacological agents, quadrado. You can see this. This is the reason why the paper of Quadrado, and coming back to my papers on COVID, it was published. It was published after fighting. And after a few months, another paper produced by Quadrado with the same title, the same. Can NRF2 be helpful in COVID? Accepted by New England Journal of Medicine, something. So you can understand that if you use the methods, if you use one methods like pharmacological agents, you receive more attention. If you use a natural methods like this, okay, European Journal of Pharmacology is a good journal, but you receive less attention. Because, okay, you can promote the healing of the people, but you can promote the intake of money. So, but must be clear, this concept. Because I accept any idea. We are on this planet with our mind is completely different. Each one is proper opinion. No problem, I can go over you. But you must tell me clearly that you prefer this one just only for a reason of marketing. Because the science is the same. So, and the first two articles on RF2 was about 20 artists, the demonstration of NRF2. I remember I sponsored myself. I did this work before Bocci, Professor Bocci, but Professor Bocci did the work in vitro. Okay, take human blood and in vitro measure the NRF2 index before and after ozone. I did the same experiment on 6 students, only 2 students, 6 students, in the University of Ancona. And I remember that we bought one ELISA to evaluate by a biochemical point of view the level of NRF2, but it's very expensive, very expensive. Now I have in my mind another paper work to do, but we need more or less 200,000 euro. Will be not easy, but we will do this. And this was the first experiment in which you can see in the bottom, before and after ozone, the increase of the level of NRF2 double. You can see if you want to see the results. But one more thing was important, because in the experimental protocol, I measured the level of NRF2 before ozone, the level of NRF2 immediately after an ozone in the bottom, and I asked to these 6 students, 3 women and 3 men, wait 1 hour, and after 1 hour, I take the blood from the other way to measure again NRF2. And after 1 week, we measure again NRF2. The fantastic thing was that, okay, in the bottom, the NRF2 increased double immediately, okay? I give oxidative stress. But we take almost 150, 200 milliliters of the full blood. We have more or less 5 liters. So in the third mission, after 1 hour, you can see the same level of NRF2. That means the information of the stress transmitted to 150 milliliters of blood was diffused to all. So now you can understand much more why sometimes we have fantastic effects with this kind of treatment. And we have some people have a problem here, and they say, I fix also this, also this. So I call a magic bullet. Also, when meet something wrong, try to fix it here. But it's not also. Now we know. This is the paper that was published at Pharmacological Reviews. Pharmacological Reviews, impact factor 90. Reading this article, I was impressed. Life expectancy has more doubled in the last century, and disease-specific to Asia became friendly. However, the pathological mechanism underlying most of them is what we said before. Instead of understanding why they are listing problem, we give medicine. They are treated with more symptomatic terms. Wonderful. But I wasn't, how could it possible that this professor said that one paper, because they never cite the name of never. Only curcumin, bardoxolone. But the key is the NRF2. That is the future. Believe me, this is the future. So, so okay. Reading quadrato system medicine, okay? So, okay, just this is very important. And quadrado in the same paper. So, because when I cite something, okay, does mean that I agree. I am really very, very happy to see, because my conviction in ozone potential is very high. So when I can read this, quadrado is working like us. Because interested the networks controlled by NRF2, different phenotypes, autoimmune, respiratory, digestive, cardiovascular, metabolic, neurodegeneration, along with cancer. It's not Lamberto Bene, this is quadrado. But I lie. So the modulation of this, but I want to show now, this is the last, 2023. How could it be possible that sometimes we have a positive or a negative effects with the same dose of ozone in the same person? This introduced that NRF2 that's checked about 2,000 genes now. Also, not only maintain the redox balance, but also regulate expression or repression. Coming back to before, if one cell there increase one gene, produce more adrenaline, is an epigenetic agonism. If the same gene is down-regulated and produce less, is a genetic antagonism, not a pharmacological agonist or antagonism. So the epigenetic is the point. Now I show you the next slide. You take 1 week to understand, because it's not just only to look how is complex this road. There are always clear that we can't use the paradigm, traditional pharmaceutical paradigm is now going to finish. All we know. In the acute, okay, we can use, but at the present, more than 45 control points have been identified, many of which represent sites of action of the NRF2 activators. You can see this. This is science published by McCord in 2023. If you give a look also, there is not the legend here, but you can see in the paper. It's very interesting because open new perspectives. So the epigenetic, that means, okay, ozone, oxidative stress, lipoperoxidase, and NRF2, modulation of genes that can up or down regulate. So if there is a problem, an illness due to an upregulation, they come back. No. And also, the dominant parallel pharmacology inducing, activating, repressing, inhibiting, or antagonizing the putative target of disease, as we can say. And so they finish, hope to see more human clinical trials to utilize and understand what has been. So what we need is this one. I give you just a few data. So integration supplementation, that is very controversial. In my clinic I use sometimes during also measure blood ozonation, that is the autohemotherapy. The concentration that I use is between 20 to 60, and the body weight sometimes we have about 100, 150, 200. In my opinion, also if the variation of the body weight is more or less the same in the people, it's not so huge. But I use the body weight multiplied 1.5. 100 kilo, 150 milliliters of water. 80 kilo, 150. This is normal. We have to take into account. We can't work just with 200, 300. And it is not dependent on the results of the healing of the patients. So sometimes you can have a good response, otherwise another response. But it's important that we use always the same protocol, so we can compare also this kind of difference. And also we use glutathione, glutathione. These are products that I reach in Germany, and vitamin C, but also only after ozone. So vitamin C antioxidant after ozone, because otherwise you can modify the response to ozone. Clinical outcomes, 30 years of experience. We treated 7,000 patients in the last, in the year 20 years more or less. And more we treat with systemic in our clinic. And the main condition treated is systemic blood, preventing anti-aging, lifestyle, and rare pathologies, very few, and chronic fibromyalgia, only few patients. And treatments related to gender, for example, in the you can see regarding fibromyalgia that now is very different. We have only 8 male, and most of the patients were female. And there is another interesting thing. On the male, the pain of the chronic pain and fatigue was more evident in the men, while in the female, no. Vice versa, in the fibromyalgic patients, women, female, we reach results in 4.4, more than the healthy. Okay, during the COVID, we treated in total 76,000 measured blood. Okay, so now this is there some treatment? Comment and conclusion. This was important. Just I was invited by the Community European Committee because they want to start new Ozone for healthcare in Europe. This was one Eurodeputato, so this is the politics. I don't know if they are looking for something, but it was very important. For the first time, a political institution called us to share our information about this. Okay, thank you very much.